सिर्फ अगर आपने सोशल मीडिया पे सुन लिया कि ये पर्टिकुलर ब्रांड की सनस्क्रीन इज वर्किंग वंडरफुली फॉर मी, बट यू एंड मी माइट नॉट हैव द सिमिलर स्किन, राइट?
ये बात आपको उन लोगों को समझानी है जो लड़की देखने जा रहे हैं। उनको लड़की की हेल्थ से कोई मतलब नहीं है, लड़की के इंटेलिजेंस से भी बहुत जल्दी उनको कुछ लेना देना नहीं है। दे वांट अ फेयर स्किन, फेयर टोन। उनको वो बहू चाहिए जो बहुत गोरी है। ऐसे लोगों को आप क्या बोलोगे? बीइंग अ डर्मेटोलॉजिस्ट, I've seen people not drinking water at all, इतना so much so that उनका थर्स्ट मैकेनिज्म ही खत्म हो गया है, एंड अदरवाइज दे आर लाइक हैविंग टू मच ऑफ वाटर। तो फेस तो ठीक हो गया लेकिन किडनी खराब हो जाएगी, लाइक दैट। सो प्लीज थ्रो सम लाइट ऑन दिस, दैट हाउ मच वाटर इज नीडेड फॉर माय स्किन पॉइंट ऑफ व्यू।
पर उसको समझना इज वेरी टेक्निकल फॉर ऑल ऑफ पीपल। अगर मैं लेमैन हूँ, अगर मैं डॉक्टर नहीं हूँ, मुझे नहीं लगता मुझे फर्क पड़ेगा कि मैं वाटर बेस्ड यूज करूँ या क्रीम बेस्ड करूँ। मुझे वो फर्क पड़ेगा मेरी स्किन पे क्या सूट कर रहा है, जो मुझे स्वेटिंग नहीं दे रहा है, या फिर अगर मेरी ड्राई स्किन है जो मुझे अच्छा लग रहा है।
एजिंग के साथ आते हैं रिंकल्स, राइट? सो दिस इज अ नेचुरल प्रोसेस। मैं इसको क्या डिले कर सकती हूँ? इफ यस, हाउ? अगर डिले बिल्कुल नहीं कर सकती हूँ तो इसको मैनेज कैसे कर सकती हूँ? अगर वो भी पॉसिबल नहीं है, देन व्हाट इज द सॉल्यूशन?
Yes, so aging is everyone's problem. Everyone wants to stay young, of course, me and you both.
At least physically. कि अब मैंने 3 महीने अपना फेस खराब किया, now I'll go for a facial, एक सैलून में जाऊंगी, एक अपॉइंटमेंट लेके इंस्टेंटली ओवरनाइट एक रिजल्ट मिल जाएगा। अगर मिल भी जाता है तो इट वोंट लास्ट फॉर मोर देन अ वीक, कितने भी प्रोमिसेस कोई कर ले। आई एम नॉट अक्यूजिंग और ब्लेमिंग सैलून्स, बट जब आपकी आंखें बंद होती हैं फेशियल्स में, आपको नहीं पता है उनके हाथ में कौन से प्रोडक्ट्स हैं, कौन सा ट्यूब खोल के आपके ऊपर क्या लगा रहा है।
So there is a method where how we can know if your eye is pigmented or is it sunken. So what you do is, sometimes our eyes appear sunken, but if you pull this area, the cheek below, like this, and your pigmentation goes away, then it is the little pigmentation that you have. But if you're pulling it and still that trough is there, it is not going away. It is a gadha.
Actually, this was a segment. What is in Dr. Suhani's bag for skincare? I really want to see. So really, if you can actually show it, I can't believe you.
I do have it, and you will see it is half used.
Show
also.
us the proof.
Yes, I have a sunscreen. It is used also. I've put it on the way.
So it is. I can see it is shiny. It is a CC cream cum sunscreen or what? It's a basic one.
It is a basic sunscreen. It is a broad spectrum sunscreen which protects me from even the sunlight and the lights.
Okay.
So yeah.
So Dr. Suhani, how to choose a sunscreen? तो मैं sunscreen कैसे लगाऊं और फिर मेकअप के साथ उसको कैसे लगाऊं? Like पहले लगाना है, बाद में, what is it like?
So you will be surprised to know I am wearing a sunscreen on my makeup right now.
On my makeup, you said?
Yes. So
after the makeup,
whenever you have to apply a sunscreen, that part goes in the last. So
but that messes up with the whole shade.
But let me tell you one fact, that physical sunscreens are more protective.
Okay.
So I personally like physical sunscreens if I'm having an outdoor activity, if I'm an athlete, if I'm a sports person, or if I'm working out in the sun, or if I have a job which I have to manage outdoors, I would go for a physical sunscreen.
What if I'm indoors? When I started experimenting with this, what I did is I took a little sunscreen, I mixed a little foundation in it and a little strobe cream. So I got a good glow, I got a good shade, and then I was protected with the sunscreen. Was it right? So men, women, all of us do that. हम अपने हाथ में product लेते हैं, we do this and we apply.
Yeah, so obviously.
And at times either we just apply and leave it, or we just keep rubbing it on our faces.
As a dermatologist, we don't recommend waxing too much, because again it is a trauma to the skin.
Too much as in?
Too much as in we don't recommend waxing.
You don't recommend waxing?
No, we as a dermatologist, we want to protect the skin. Skin is the largest organ of our body. We should not give any trauma to the skin.
I always say this to my sisters, जब भी आप मेकअप लगाओ, मेकअप लगाने से ज़्यादा important है मेकअप को रिमूव करना, और सही तरीके से रिमूव करना, और completely रिमूव करना. What happens is at times you don't remove it properly. In the morning, आपके pores में चला जाता, and your kajal and your eyeliner come still here, and you look like a bhoot. So so how to remove your makeup? एक अच्छे मेकअप रिमूवर में क्या होना चाहिए? स्ट्रेस, पोल्यूशन, कम सोना, ज़्यादा सोना, अल्कोहल, नॉन वेजिटेरियन फूड, वेजिटेरियन फूड, सप्लीमेंट्स, न्यूट्रिशन, इन सब का स्किन पे क्या असर पड़ता है? ऑल्सो हम कभी कभी बहुत ज़्यादा टॉपिकल एप्लीकेशन करते हैं, दैट मीन्स ऊपर से बहुत सारे क्रीम्स और ऑइंटमेंट्स लगाते हैं, बट स्किन ठीक नहीं होती, स्किन की क्वालिटी बेटर नहीं होती है. वाई? बिकॉज हम ये भूल जाते हैं कि हमारे पास डिफिशियंसी है किसी न्यूट्रिशन की, किसी सप्लीमेंट की. फूड को लेके। स्किन की बेसिक केयर कैसे करनी है, स्किन के टाइप्स कितने होते हैं, रिंकल्स, ओपन पोर्स, एजिंग, मेकअप रिमूवल कैसे करना है, शेविंग कैसे करनी है, वैक्सिंग और थ्रेडिंग का तरीका क्या होना चाहिए, ऐसी बहुत सारी चीजें आज डिस्कस की है मैंने अंडर LIPS लाइफस्टाइल इमेज पर्सनालिटी स्किल विद मी स्नेहा सिंह। एंड फॉर दिस पर्पज आई हैव इनवाइटेड टुडे डॉक्टर सुहानी भाटिया, who is a consultant dermatologist. She's renowned and she's very, very passionate about skin, hair, nails, and the overall hygiene. She says skin is the largest organ of the body. You should take care of it at the most. और जो हमारे बहुत सारे स्किन को लेके मिथ्स है ना, वो आज हम बस्ट करने वाले हैं, स्पेशली दिस प्रोडक्ट मेला। बहुत सारे प्रोडक्ट्स जब हम देखते हैं मार्केट में, इंटरनेट पे, इन्फ्लुएंसर्स के साथ, सेलिब्रिटीज को एंडोर्स करते हुए देखते हैं, तो हमारा मन होता है हम सब यूज कर लें, हमें लगता है हमारे लिए सब कुछ ठीक है। तो हमारे लिए पर्टिकुलरली क्या ठीक है अकॉर्डिंग टू आवर स्किन टाइप, स्किन रूटीन कौन सा बेटर होगा, स्किन के लिए सप्लीमेंट कौन सा बेटर होगा, स्किन के लिए एक रेजीम कैसा होना चाहिए एज वाइज, एवरीथिंग वुड बी कवर्ड टुडे। सो लेट्स मूव ऑन। So Dr. Suhani, welcome to Lips.
Thank you so much.
Thank you so much for coming. मुझे आपसे बहुत सारी बातें पूछनी है। आपके पास तो बहुत टेक्निकल वर्ड्स होंगे, but I would really request you अगर आप बिल्कुल layman terms में समझा पाए, that would be easy. Let's start with skin types first of all. How many types of skin are there? आपके पास कौन सी problematic skins आती हैं? कितने टाइप की skins होती हैं?
तो बहुत ही बेसिक लैंग्वेज में I think there are majorly 4 types of skins. That is oily, dry, a combination, and a very normal skin. So how can we know what type of skin we have? First, oily skin. Whenever during the day, if you've not applied anything, no moisturizer, no sunscreen, still you're feeling sweaty, or if you have applied the minutest of the product, still you're feeling very shiny or oily and you have to keep on washing the face, then you have oily skin. When you wake up in the morning, it feels shiny and oily, then it is oily skin. As simple as that. Dry skin is when you wake up in the morning, you feel itchy or you see visible cracks या फिर थोड़ा खींचापन on the skin, that is dry skin. Okay, and combination is mostly the combination, as the word suggests, oily and dry both. So most of the time the T-zone, that is the forehead and the nose.
The forehead and the nose. This is called the T-zone.
Yeah, so that it can be oily in a lot of people, and the cheek part can be itchy and dry. So that is a combination skin. I myself have a combination skin. So the most lucky people actually are the people with normal skin.
That's me.
Yeah. So you're very lucky because you might not have the oily skin issues, you not have a dry skin issues. Basically, people with normal skin require the minimum products. Yeah. So they don't need a lot of products to manage their skin.
So you said people with normal skin are lucky. So yeah, I would say that. So am I right? Please tell me. When summers come, I have to apply a little more, like I cut down on my moisturizers too much. And during winters, I, go up with my moisturizers.
You're absolutely correct. So normal skin people like you are very
Normal
lucky.
people.
Yeah.
That's good.
Yes.
Yeah.
So they're very lucky because obviously they need the minimum products when it comes to skincare. Like you said, when there are summer months, we need less products because anyways we are sweating a lot. And when it is winters, the dry skin might come up. So we need to layer.
Okay. Yeah. Okay. Fine. So this is skin types. Now tell me, we'll start with skincare. So skincare not in like too much detail कि मुझे सुबह से रात तक कुछ लगाना है and I have to like do so much. With the kind of time routine we have these days, we don't have ample amount of time these days.
Yes.
And I have to go for work, I have to go, I have stress, I have pollution outside. There are so many factors. So especially during motherhood, when the new mothers are there, they keep saying कि मुझे तो face wash करने का भी time नहीं मिलता है. So in that case, in all these cases, according to skin types, let's start with oily skin. What is the basic oily skin के लिए skincare routine?
I think skincare should not be put specifically to the type of skin if you're talking about only basic skincare. So just 3 things anybody of us, one should have in their skincare routine is a face wash, obviously depending on your skin. Then there's a moisturizer to make a barrier on your skin. And third is a sunscreen. As basic about it, even if like a 50-year-old comes to me who has not done skincare ever in his or her life, that is the 3 things that I'll recommend them.
Okay.
If they do not have obviously a bigger issue.
So these basic 3 things they should have either in their bags or on their dressing table.
100%. Yes.
Okay.
Everyone.
And from which age they should start taking care of the skin? Actually, skin कब से deplete होना start होती है? That is after 25 or after 30?
So actually the thing is the first part of your question, what is the ideal age of skincare? I think there is no ideal age. When we were young, when we were just born, पुराने ज़माने में दाइज or the doctors or even our mothers, grandmothers, dadi, nannies, every one of them have been doing skincare on a baby in the form of oil massage. So that is nothing but moisturization. So it starts from day one, ideally.
Right.
But yes, if you're talking about a particular skin regimen, then it usually generally starts around puberty, when we enter the teenage years, because that is when most of the things are happening. The hormonal changes are happening, a lot of secondary characteristics are happening. There's acne, there's hair growth, hair fall, relating to the stress and everything. So that is the most common age when we visit a skin doctor to get a regimen.
We should at least.
We
right?
should at least.
Carefree people like me, we haven't taken enough care
Yeah.
during our teenage. And we are still carrying the marks and pores. Although I love these because these are mine, but still, like, you know, you should go to the doctor.
So according to my honest opinion, the ideal age of skincare is today.
Is today.
Yes.
Please say it again. Please say it again. This is beautiful.
So according to my honest opinion, the ideal age to start skincare is today.
See, it's today. So please pause this video. If you haven't washed your face, please go wash your face.
Yes.
If you haven't applied your moisturizer on your face, please do that. If you don't have a good face wash, please buy one with the recommendation of a dermatologist, of course. But please try to do it today. So pause this video here and please go and do it today.
Perfect, yes. So even if you're 40s, 50s, even 60s, you've not done anything, if you visit a skin doctor today and you start, it is the perfect time, because skincare is a consistent journey. It is not about days or weeks. It is a long-term process.
Okay.
Consistency is the key.
Of course, of course. I saw myself when I started my night routine, especially religiously, it actually changed my skin. And I would say it changed my skin overnight. But I realized it needs to be done every day.
Yes,
yeah.
of course.
And especially women who are above 50, above 40. They're like, अब क्या हो जाएगा, अब तो कितना ही change कर लेंगे, you know, and कितना ही, you know, फर्क पड़ जाएगा. But you busted this myth कि ऐसा नहीं है. The best time to start is today. And you can start from today, whatever age you are. Now, so होता क्या है, Dr. Suhani, that people think कोई भी deficiency body में है, वो उस पर ध्यान नहीं देते हैं. What usually people do is they start applying topical products. कि ऊपर से कितनी भी बहुत सारे अच्छे cosmetic creams लगा लेंगे या बहुत ointments लगा लेंगे, बहुत types के जितने हमें दिखते हैं आजकल इंटरनेट पे. And this would solve the problem. Dermatologist के पास भी जाते हैं तो usually what is your course of action? Do you ask them for supplements in their nutrition or deficiencies that they have, or you just generally recommend everything?
So 100%. Obviously, if somebody is coming to me, just giving the products is not going to be enough. They are not going to turn up again because nothing will work for them. They need a holistic treatment for their skincare, hair care, or nail care, of course. So we obviously recommend.
ये तो मैं भूल ही गई थी, nail care भी होता है, sorry.
So we obviously recommend a lot of medicines. That is according to the concern. But nutrition, the deficiencies, the supplements, they play a very big role when it comes to skin, hair, or even nails. So touching the skincare first, if somebody is coming for acne, I have to counsel them about the diet. If I'm giving a list of 5 medications, something to eat also, like a tablet for acne, but if they are going and eating junk and sugary foods, my treatment is not going to work. True. So what they'll do is they'll just keep changing the doctor, thinking that that is not working for me, maybe I should change the regimen. It is not like that. There are certain foods for every concern which have to be managed well. And in a general consensus, obviously junk food, the sugary drinks or the sugary food obviously is going to increase the concerns. For example, when it comes to hair care, people who are losing the hair, there is a big reason that their nutrition might be responsible for it. Okay. Because hair is basically a protein. It is keratin. So we need it. If we are not eating protein, we are not going to increase our hair. Okay. Only if it is genetic, that is another thing. That due to our genetics, we are losing our hair. But if it is nutritional, we have to correct it. Right. It is not going to help.
So nutrition में सबसे ज़्यादा problems आपके पास किसको लेके आती हैं? Mostly I've seen women with less hemoglobin.
Yes.
And they keep applying something on very skin क्यों नहीं ठीक हो रही है and all that. They drink less water. Yes. ये like a layman I'm saying this to you, what I've noticed. But please tell me what kind of deficiency is the first thing you need to get checked should be what?
Yes, so basic, when a patient comes to us and we think it is because of the nutritional deficiencies, which mostly is the case, we do a very routine blood test.
Wait, you said mostly is the case.
Mostly is the case, yes. Sometimes it is not the problem is not the skin or the hair per se. It is the nutrition part.
The deficiency basically.
The deficiency.
Okay.
So if a person has not had blood test for a long time and we can see the person might appear little pale or the hair thinning is too much, we have to get investigated. We have to check for hemoglobin levels. That is the utmost thing. Sometimes there is itching on the body. We have to check do they have any subclinical infections. That again requires blood tests. If they have hair thinning, we have to rule out thyroid diseases.
Yes.
So hormonal diseases we have to rule out.
Yeah.
So we get it done. People are applying a lot of skincare products, but they're still appearing pale. Might be the hemoglobin.
So you said hemoglobin ka kam hona, hormonal issues, thyroid issues. What else is one issue? Of course,
Vitamin deficiencies.
vitamin deficiencies.
So pigmentation.
Okay.
It can be because of vitamin B12 deficiencies.
Okay, let's go.
A lot of people
serial
have.
wise. So what kind of deficiencies create what kind of problems?
So a lot of deficiencies are creating problems. Number one is hemoglobin. So that will affect the skin and the hair as well as the nails.
Okay.
A lot of time brittle nails are because of the hemoglobin deficiencies or the vitamin deficiencies we are not taking properly through our diet. Then vitamin B12 deficiencies, vitamin D deficiencies.
Vitamin B12, vitamin D, these are the most crucial ones you're saying for the skin point of view.
Yes, vitamin B12 and vitamin E also. Vitamin B12 will cause pigmentation. Might have seen a lot of knuckle pigmentation happening.
Like people have black knuckles and especially knees and elbows also.
Yes, we have to rule out vitamin B12 in them.
Okay.
Then vitamin D deficiency is related to the hair.
Okay.
Whether you're getting thinning, whether you're getting small bumps, which we call folliculitis.
Folliculitis.
Yes, we have to give vitamin D supplements to them.
Okay.
Yes. And then vitamin E is very good for skin because it is making a good barrier. So sometimes when there is dry skin or itchy skin, we give vitamin E to create
as a food or as
it's like an oral moisturizer.
Oral moisturizer.
Yeah.
Okay.
Vitamin E.
So when you said oral moisturizer, what people do is usually मैंने थोड़े time से trend देखा है that they buy the vitamin E capsules, they break it and they mix it in their creams and oils and they apply it on their faces. Is that right?
It's not right per se. It is better to eat it by natural sources. I would say vitamin E rich products or vitamin E tablets also we recommend sometimes, not to everyone. You will not see vitamin E in my prescription for every person coming to me. I can obviously give an external moisturizer if I want to create a barrier. Vitamin E supplements per se are for those who have extremely dry skin. Extremely dry means that they have visible rashes. For them, we recommend vitamin E.
Okay.
It is not a bad thing, but mixing in the creams and everything, that is, I think, a very tedious process.
Yeah.
I'm not going to give a lot of returns.
Yeah, those so many videos we watch ना इससे डालने से मेरे बाल बड़े हो गए, so people do that. But and actually it attracts you. कभी-कभी मैं भी सोचती थी कर लूँ क्या, but I said नहीं, डॉक्टर से पूछे बिना.
The thing is, these home care hacks can be very distressing.
I'm going to come on that. I have a list of ingredients, amla, nimbu, besan, whatever people apply on their faces. We'll come on that. So deficiencies mein, first of all, get your hemoglobin checked, vitamin D checked, especially B12, right? However, जो भी डॉक्टर सुहानी बोल रहे हैं, whatever she is saying doesn't mean that आपकी ड्राई स्किन है तो आज से आप जाके विटामिन ई की कैप्सूल्स लेना स्टार्ट कर दें. प्लीज रेकमेंड अ गुड डॉक्टर. अगर आपको कुछ भी समझ में नहीं आ रहा है, द नियरेस्ट डर्मेटोलॉजिस्ट दैट यू हैव, एटलीस्ट जस्ट बेसिक रिकमेंडेशन कि मैं खाने में ऐसा क्या खाऊं, एंड स्पेशली अपनी रिपोर्ट्स पहले करवाइए, स्पेशली द ब्लड रिपोर्ट्स. यू सेड डॉक्टर सुहानी, जब हम एक्स्ट्रा सप्लीमेंट्स की बात करते हैं, कोलेजन, ग्लूटाथियोन एंड विटामिन सी, क्या ये खाना जरूरी है फॉर स्किन? पीपल यूजुअली टेक बॉटल्स अपॉन बॉटल्स. बहुत अट्रैक्शन होता है यूट्यूब वीडियोस देख के, इंटरनेट देख के कि अच्छा ग्लूटाथियोन खाने से मेरे इतने दिन इतने टाइम में मेरा स्किन फेयर हो गया एंड थिंग्स लाइक दैट. सो इज दैट करेक्ट? ऑफ कोर्स यू विल से नो, बट हाउ मच कोलेजन वर्क्स? बहुत ज़्यादा कोलेजन सुन रहे हैं पास्ट 5 years से. एंड कोलेजन कितना काम करता है, ग्लूटाथियोन कितना काम करता है, एंड अगर काम करता है तो किस चीज़ में काम करता है, किस प्रॉब्लम को सॉल्व करता है?
So yes, the trend of collagen, glutathione and all those supplements is booming, especially on social media. That you are very correct. But the thing is, collagen doesn't work for everyone. A lot of hoax products are also available. First of all, there's a myth that something called veg collagen. I think mostly animal collagen only works. So vegetarians, they would take offense.
I know.
But yes,
because I have bought dabbas of it, and then I realized इससे कुछ नहीं होना है.
Yes. So collagen doesn't work in everyone when it comes to skin.
Veg collagen में कुछ भी फायदा नहीं है.
No.
Okay, I'll throw that.
And bovine collagen is still works, but for some issues, it's not like if I have a skin concern and I'll eat 1 box of collagen and I'll be sorted. It is not like that. There is a reason they are called supplements. So they supplement the other important things which a doctor recommends you. Coming to glutathione, the biggest myth is eating glutathione will make you fair 100%, but it is absolutely incorrect because eating glutathione, the absorption of glutathione by medicine, oral medicine, is about 0.01%.
What are you saying?
Yes. So you have to eat glutathione maybe for 20-30 years to see some result.
20-30 years.
Yeah, minimum. That also like
So start
a very
when you're born.
result. Yeah.
So better start when you're born.
But the thing is, it is not. A lot of, I think your audience might disagree that no, we've eaten glutathione and it has worked for me and we might have had fair skin. I don't think so. You're just eating glutathione. Your tablet might contain other vitamins also which may be working for you.
Okay.
That is one thing. Plus, I don't think so anybody eats glutathione like that and doesn't use a moisturizer and a sunscreen. They might be using that and might that be working better for them.
Yeah.
Of course, IV glutathione is very popular now.
IV glutathione.
IV glutathione is when we give intravenously.
Okay. That means basic in a layman language, through a needle.
Through a needle. It goes into the blood directly.
Okay.
That is only and only done by certified dermatologists.
Okay.
Okay.
And it does work?
It does work.
For what?
But it is temporary.
Okay.
Yes. Glutathione is temporary.
Okay.
IV glutathione will work, but it will give temporarily a change in the skin tone.
Okay.
So we obviously counsel the patient that this is not permanent. You might have to get it done repeatedly, like maybe once a month for a consistent result. But with the moment you stop it, the moment it goes out of the blood, it is gone.
Okay.
It's not going to stay. So, yes.
So what is consistent? Your food?
Consistent is your food, number one. Water.
I wanted to ask you water-wise. बहुत सारा पानी पीने से बहुत अच्छी स्किन हो जाती है. How true is this?
So it is not like if you drink 10 glasses of water every day that you will become Deepika Padukone. It's not happening. Sorry, you will not be Alia Bhatt. Of course, drinking water helps a lot because it detoxifies a lot of things. It gives you hydration which you need. But only drinking water is not going to help you. Otherwise, everyone would be drinking water only. Why are we for? Why have I studied 10 years to tell you that water is just not enough?
Of course. At times it goes into extremes. So either I've seen people not drinking water at all, so much so that unka thirst mechanism hi khatam ho gaya.
Yes.
And otherwise they are like having too much of water. So face to theek ho gaya lekin kidney kharab ho jayegi. Like that. So please throw some light on this, that how much water is needed for my skin point of view.
Yes. So everything in moderation works well. तो आई थिंक व्हेन इट कम्स टू वाटर जितना भी पियो इट इज ओके, बट ऐसे मत सोचो कि सबसे ज़्यादा से ज़्यादा पियेंगे तो ही बेनिफिट होगा. आई थिंक 6 to 8 glasses per day. It is very difficult to measure sometimes. We can't keep measuring glasses. What you can do is just take a 1 liter bottle, finish 2 bottles every day. That's it. Keep your bottles separate so that you know you're drinking enough water.
So I had this habit, Dr. Suhani, personally speaking. I was not drinking enough water. And being a dancer, I used to dance like all day long और मैं पीती नहीं थी पानी. So what I did is मैंने अपने अलार्म सेट कर लिया किसी ऐप को डाल के. Now every hour it would make a sound, water sound, कि आपको याद दिलाने के लिए. And even then I didn't used to have water. मेरी पूरी family अलार्म सुन के पानी पी लेती थी, but मैं नहीं पी पाती थी.
Ma'am, the thing is we are caught up in technology so much.
I know.
I don't think so anything in this earth, on this earth, can help us do something which you don't want to do.
Yeah. But when you lose elasticity, when you see कि पानी कितना ज़रूरी है body के लिए, you start. जब कोई problem होती है ना कि लगता है कि नहीं अब डॉक्टर ने बोल दिया you might have UTI, you might face this problem, then you start drinking it. So better start drinking water today. But बहुत overboard भी नहीं जाना कि 4 bottles लेके बैठे और ये 2 घंटे में खत्म करनी है ना, आप भूखी चली जाती है खाना खाने के लिए, right? So your hunger goes over. Now, yeah, tell me. So water is done. You said food, you said water. Now tell me about sleep. How much sleep do I need from the skin point of view every day? सबको पता है 7 to 8 hours usually body के लिए ठीक होते हैं, but for skin at least, जैसे लोग बोलते हैं कि मेरी तो नींद 4 घंटे में पूरी हो जाती है. Is it right?
It is not, because the thing is कि skincare is not just about applying products. You need to eat the right food. You need to have an adequate amount of water. Again, you need to have an adequate amount of sleep and keep your stress levels in check. So sleep and stress is also related. So minimum 6 to 8 hours of sleep one has to have if you want to have a good skin, hair and your life, right? I would say.
So people who don't work out, Dr. Suhani, usually बहुत ज़्यादा physical work नहीं है, उनको नींद ही नहीं आती है. In that case, there are 2 questions. So how important is the sleep and how important is the workout for my face, for my skin especially?
So yes, exercise, any form of exercise, maybe it is gym, yoga, or playing any sport, which I prefer. So I think it is very important for the skin because it will, one, take care of your stress levels. Secondly, it will sweat all your problems out, I would say. And it will help you to cleanse the skin properly and everything, and it gives a feel good factor also.
Yeah.
So obviously workout is better, then you get tired and you will sleep well. You'll be
Right.
happy about it, and it gives a consistent fitness regimen also along with the skincare. So like I said, skincare is a consistent process. Likewise, fitness is also.
Right.
So a lot of patients who do not have a form of physical activity, we always tell them, because skin will see wonderful improvement.
Acha.
Skin will see wonderful improvement if you are incorporating any physical activity. So we are not biased towards any. If you don't like gymming, you can do yoga. Yoga, even normal walking you can do. You can start with 20 minutes, go to 30, 40, 1 hour is enough. So that is what.
But especially Dr. Suhani, personally I've seen this, especially after cardio, the way your face glows. You just want to lock it there. You don't want any makeup
Yes,
after that.
so any kind of exercise, be it walking, jumping, running, playing a sport. So what it happens is it causes vasodilation, because there is
Please, it causes what?
vasodilation. So basically there is expansion of the blood vessels, so we feel very red and glowy.
Red and glowy.
Yeah,
Yes,
so we
yes.
blush.
We blush.
So if you want that blush, you
keep
should
working out
exercise.
24/7.
Yes, of course. And sleep is very important, because body also needs rest as much as your mind does. Even your skin does.
Yeah.
So if you sleep well, you wake up fresh. Even the timing of sleep also matters.
So that's a major issue.
Yeah.
We've turned into nocturnal animals. We stay up till 2, till 3 a.m.s. How does that mobile ki light affect the skin? This was my favorite question to ask you today.
So thanks to post-COVID era and the constant scrolling of the reels and now the threads, I think every one of us might be tempted to be awake beyond our normal hours. I think it is very damaging for the skin.
Right.
So whoever comes to me with the facial pigmentation or under eye darkening, first thing I ask is screen time. So screen time plays an important role because the light from the screens which is coming, it is also a kind of light which is damaging to your skin.
Okay.
So it is not just the sunlight. The screen light, the LED lights, the tube lights in our houses are equally damaging.
Is it?
Yes. So that can be very damaging to you.
Okay.
So you have to limit your screen time, sleep well, sleep on time. You should keep your own sweet little time for Instagram. That is okay.
Right.
But it should not be beyond your normal hours.
So if you're watching this right now and it's 2 a.m. or 3 a.m., please stop it here. We'll meet you again tomorrow. Please watch it again tomorrow. So yeah, Dr. Suhani, that was, I know it is painful for many of us to think about it. The problem is, क्योंकि हमें ये change एक दिन में नहीं दिखता है. We can't see our skin getting damaged like each minute कि अच्छा अब इतना और blemishes हो गए इतना ये, suddenly तो दिखता नहीं है. So that's why we don't actually pay attention to such things. Skin problems में एक major चीज आती है, that is aging. Aging के साथ आते हैं wrinkles, right? So this is a natural process. मैं इसको क्या delay कर सकती हूँ? If yes, how? अगर delay बिल्कुल नहीं कर सकती हूँ तो इसको manage कैसे कर सकती हूँ? अगर वो भी possible नहीं है, then what is the solution?
Yes, so aging is everyone's problem. Everyone wants to stay young, of course, me and you both.
At least physically.
Yes, at least, no, everything. Mentally,
Yeah, mentally I want to grow. Now it's so liberating, it's such a carefree. After 30, you're like, oh, who cares? Leave it.
Yes.
So, yeah.
So when it comes to skin point of view, aging is a natural process. We cannot fight it till the end. Obviously, we can delay it. So what if you want to delay it the farthest is that you have to use a sunscreen. That is the most basic part of it. And anybody who is listening to me is late if they are not using right now.
If you're not using a sunscreen, you are late. Dr. Suhani is saying कि अभी आपने मेरी बात सुनी है तो start it today again. One is skincare routine and second, sunscreen. Sunscreen is a holy grail, I guess, right?
So after 6 months of age, the very first year I'm saying, after 6 months of age, one can start a sunscreen.
6 months of age, you're saying?
Yes.
Like a kid, you're saying?
Yes. Even kids can do sunscreen, can use sunscreen.
Can or should?
They should use sunscreen. Even kids should use sunscreen.
तो छोटे-छोटे babies के हाथ में पकड़ा देते हैं, खुद ही लगा देना. You can't do that. So you have to tell mothers when to start.
Mothers should start sunscreen mostly after 6 to 8 months of age in babies. It is absolutely fine.
Okay. One is it is absolutely fine, and second
safe.
is you must do it. So you would recommend they must do it?
They must
should
do it.
Okay.
It will delay the aging process by so many years. You'll not get it that time.
Your kid would literally bless you when he or she will grow up. But Dr. Suhani, does like baby sunscreens bhi hoti hai?
Of course, they're there.
Okay.
baby safe sunscreens are there. Most of the sunscreens are safe for babies, but there are certain particular products also which we give for baby skin because it is obviously more delicate than our skin.
Of course.
So sunscreens are available. Everything is available. You just have to start at the right time.
Okay.
So like I said, if you want to delay the aging process, sunscreen is one thing you should start. I actually have it in my bag right now.
Oh, you know what? Actually, this was a segment. What is in Dr. Suhani's bag for skincare? I really want to see. So really, if you can actually show it, I can't believe you.
I do have it, and you will see it is half used
Show
also.
us the proof.
Yes,
Oh.
I have a sunscreen. It is used also. I've put it on the way.
So it is. I can see it is shiny. It is a CC cream cum sunscreen or what? It's a basic one.
It is a basic sunscreen. It is a broad spectrum sunscreen which protects me from even the sunlight and the lights here.
Okay. Okay.
So yeah.
So Dr. Suhani, how to choose a sunscreen? How to choose a moisturizer? How to choose a body lotion? How to choose a scrubber? How to choose my facial creams? मैं सब पे आने वाली हूँ. So let's start with sunscreen. How to choose a sunscreen?
So choosing a sunscreen is a very basic thing. First, you should know there are two types of sunscreens. In a very basic language, there is a physical sunscreen जो एक physical protection देगा.
Okay.
कहने का मतलब है कि अगर sun की rays हम पर गिर रही हैं, they should just reflect. कि हमारे पास एक physical armor है, we have a physical protection, वो हमें छुएंगी और दूर चली जाएंगी.
तो basically we're building a layer.
Yes, that is a physical sunscreen. फिर होती है केमिकल सनस्क्रीन. केमिकल सनस्क्रीन ऐसी होती हैं कि कुछ ऐसे मॉलिक्यूल्स हैं जो उन्होंने स्किन केयर प्रोडक्ट में सनस्क्रीन में डाल रखे हैं कि सन हम पर आएगा, सन की रेस, दे विल गेट एब्जॉर्ब्ड, दोज मॉलिक्यूल्स विल वर्क एंड दे विल मेक इट लेस डैमेजिंग.
Less damaging.
As simple as that.
Okay. Yeah. So one is physical, second is chemical.
Yes.
Which one is your personal favorite or which one do you recommend the most?
So I feel both are very good. The only thing with some of the patients which I hear is physical sunscreens क्योंकि वो एक barrier दे रही हैं, एक layer दे रही हैं, they will give you a white sheen. Okay. So that is because they have a molecule which is titanium dioxide.
Titanium dioxide.
Yes.
And I was about to ask you, is there a sunscreen available in the physical category that doesn't have a white sheen?
A lot of them are there because physical and chemical mixture sunscreens have come out because of this problem.
Okay.
But let me tell you one fact that physical sunscreens are more protective.
Okay.
So I personally like physical sunscreens if I'm having an outdoor activity, if I'm an athlete, if I'm a sports person, or if I'm working out in the sun, or if I have a job which I have to manage outdoors, I would go for a physical sunscreen.
What if I'm indoors?
We can go for both physical and chemical.
Okay.
Either of the two. If you absolutely don't like a white sheen, then you can go for a chemical one.
But that's okay. When you said there's so much chemical and molecule happening on my face, I don't want that. I just want a layer. So physical one would be okay.
Physical one will be okay.
Yeah.
So we have tinted sunscreens also.
Tinted ones,
for people like me and you who have to interact with a lot of people. Like you have a bigger job than me, that is mentoring a lot of people.
Meeting people
too much. Likewise, I have to meet so many people. If you want to not go for a makeup look, it is better to go for a tint sunscreen because it has a lot of has a little bit of tint. Again, it is because of molecules like titanium dioxide, iron oxide, zinc oxide.
Okay.
So that gives a tint. Basically, it gives a pink appearance like you have done mild makeup, but it is not.
So, okay. So there was a formula that really worked for me, at least look-wise. How right it is, please tell me. There were two things that I had tried. Once, when I started experimenting with this, what I did is I took a little sunscreen, I mixed a little foundation in it and a little strobe cream. So I got a good glow, I got a good shade, and then I was protected with the sunscreen. Was it right?
I would not say it is not correct.
Okay.
But like if you don't want to go for a makeup per se every day because mixing and this thing you might not get time and everything. There's a fact that I'll tell you. If you see your foundation, it will have iron oxide.
Okay.
So any product which is giving you an even tone or a tint will have these products. This is the chemical part of it.
So why foundations oxidize as well?
Yeah, that is why. Okay. That is why they have an expiry, basically. So they have these chemicals, plus they have their patented products according to the brand. So there's no point, though there's no need of mixing too many things. You can just buy a tinted sunscreen if you want to have a makeup look someday.
But only issue is at times you don't find your right shade or you don't find the right kind of glow. So it kind of worked for me. But if somebody can do that, there are only 3 creams, 3 tubes. Sorry, there are only 3 tubes on your makeup table in your vanity and you're just done. So if it's working for you like I've done, but I think I would recommend please try this. I have tried this and it has worked for me. But that white sheen doesn't go for sure.
Yeah.
But when it gets mixed with this foundation, your own shade, I think it works okay.
It works okay, and a lot of tinted sunscreens also come in a lot of shades. So that also you can go for. You can obviously meet a dermatologist, meet an expert. They will be able to help you. We mostly have samples we can give you to try on.
Okay.
What suits for your skin. You can buy that.
I'm coming to you today.
Of course, most welcome.
So my sunscreen was too dry. I like dry sunscreens. So I want to come. So I want to ask you one major thing. कुछ sunscreens होती हैं जो बहुत oily होती हैं.
Correct.
They do protect, but बहुत oily होती हैं. Few are very dry. So what kind of sunscreen would you recommend to what kind of skin?
Yes, so basically the types of sunscreens जो कि matte based हैं या cream based हैं या gel silicone based हैं, they have been formed because of the type of skins that we have. अब एक किसी की oily skin है, उनको अगर मैं cream based thick sunscreen दूंगी, they'll keep sweating it.
Okay.
And they'll not apply. 15 दिन बाद मेरे पास आएंगे फॉलो अप एंड दे विल से कि मैम ये तो हमसे नहीं लगी. क्या वी आर स्वेटिंग अ लॉट, हम कैसे लगाएं? आप कह रहे हो 2 बार ही लगाना है दिन में. हाउ विल वी पुट इट? So obviously I have to give a drier sunscreen to them. I'll have to give a matte finish sunscreen to them.
Matte finish, हाँ.
So that is where our role comes into importance.
Okay.
सिर्फ अगर आपने सोशल मीडिया पे सुन लिया कि ये पर्टिकुलर ब्रांड की सनस्क्रीन इज वर्किंग वंडरफुली फॉर मी, बट यू एंड मी माइट नॉट हैव द सिमिलर स्किन, राइट? So meet a dermatologist, get yourself diagnosed that what type of skin you have, what product will suit you, tell your concerns. For example, if I'm a sports person, मुझे sweating होता है, I can't apply a cream based sunscreen. I'll have to go for a matte one or I'll have to go for a physical one कि मुझे protection भी मिले और मुझे obviously पसीना ना आए ताकि मैं at least reapply कर पाऊँ. एक ही बारी sunscreen लगाना वैसे भी थोड़ा कम effect देता है. और अगर मुझे इतनी स्वेटिंग होगा तो मैं कैसे लगाऊंगी?
Okay, so you said outdoors and indoors. If I'm outdoors, I have to apply it. If I'm indoors, what should be the timing? Shall I start at 10 in the morning, 11 in the morning? Also, there are few parts of India where it's too hot, scorching heat for 6 months straight. So please tell me according to that.
So like I said, screen time or the LED lights or the tube lights in our house is equally damaging. So there is no particular time.
Okay.
When you wake up in the morning, you've done your face wash, moisturizer, everything, you have to apply your sunscreen. Even if you're sitting at home, working from home, not going outside anywhere, you need that sunscreen.
How frequently shall I reapply this?
So what is recommended in the research studies is that generally you should apply the sunscreen every 2 to 3 hours.
Okay.
But it can be obviously very difficult in the schedules that we have. But what I tell my patients is minimum reapplication twice.
Twice.
Yes. But if you have pigmented skin or if, for example, you have blemishes, it is advisable to apply 3 to 4 times.
But after washing your face, not that एक के ऊपर एक हम apply कर रहे हैं, not that. Like wash your face and reapply, right? But if I'm going to apply the sunscreen so much, you were so right that you have to recommend, you have to see a doctor, professional dermatologist for this, because this is a one-time process. Once you're done with your process कि मुझे ये sunscreen लगानी है, you can have it in your bag, in your vanity, everywhere. मैं ऐसा करती हूँ personally. I keep 3 to 4 sunscreens एक car में कहीं, in case you forget or in case you want to reapply, you should have one handy. So now, Dr. Suhani, मुझे ये पूछना था आपसे, double plus, triple plus, UV plus, there are so many formulas. What shall I see on my tube before applying this? And what does it mean?
Yeah, so there are 3 major things or 4 to see on a sunscreen. One is what rays is it protecting from? So it is from the sun, if I'll say, ultraviolet rays are the damaging ones. So it is UVA rays and UVB rays. So there's a spectrum, not going into details. There is UVA, UVB. So some sunscreens protect from UVA, some protect from UVB. There are chemicals in it to protect from them. And the best sunscreens are the broad spectrum one, which will protect from UV and UVB both.
Okay, so what is written in the
So
on
one
the
thing
tubes?
is UVA plus UVB protection will.
So you should buy such sunscreens जिनके ऊपर UVA plus UVB लिखा होता है, right?
Yes.
And how many pluses should be there? Plus, triple plus, 4 plus. What does it mean actually?
So it is a PA factor. So that is a technical protectant factor in the sunscreen.
So actually, does the PA work like अगर 3 pluses हैं तो that means 3 hours? Does it work like that?
No, it's not about hours. It is not related to the timing. Okay. It is related to the potency of the sunscreen, if I can say that how protectant is the sunscreen. Nothing related to the time. 2 plus or more is okay.
And what about SPF?
Yeah, so SPF is sun protection factor. Don't go crazy about it. For Indian skin, 30 and above is absolutely safe. So it doesn't mean that if I'm using a 30 SPF and you're using a 50 SPF, you're getting
More protection.
No, you're
Long hours.
You're getting a very huge difference in the protection. So the difference is 95%, 99%.
Time-wise or protection-wise?
No, the protection amount-wise.
Okay.
So, for example, I'll make it very simple. SPF 30 protects 95% of the sun rays.
Okay.
And SPF 50 will protect about 99% of the sun.
So it's not about 3 hours or 5 hours.
Yeah.
It's about the percentage.
Yes. So these days products are coming with 80, 90, 100
Yeah,
plus
yeah.
SPF.
Is that right?
I think it is 99.9999. If you want to go too crazy about it, you can go. But there is
that
one
harsh
thing.
on the skin?
Yeah, the more the SPF, it becomes little thicker and it is difficult to formulate. That is why there are not huge brands, a huge number of brands also with higher SPFs. So 30 and above is absolutely safe.
Okay.
It is perfect. I have the one I showed in my bag is SPF 30.
Okay.
So if I'm using a 30, it is...
Yeah, blindly go for it. You can go for SPF 30.
Yeah.
So I was in Sikkim at one point of time in 14,000 feet. My husband is in the army. So हम लोगों की posting हुई थी वहाँ पे and I was there. Sunlight was very harsh. Without the sunglasses, you can't go out. आपकी eyes, at times it goes blind for 3 days in a row if you're standing in that under that sunlight for like half an hour straight. So skin was taking a huge toll. So what we used to do is, I used to take like 80 plus and 100 वाला जो SPF है, it was working for me and only that was working on me. So इससे आप सोच सकते हैं, हम जहाँ normally रहते हैं, we don't need that SPF every day, right?
Yeah, that is, we don't need a lot of like the huge amount of SPF. But what I would like to recommend is the best form of protection is physical protection. How much ever you use sunscreen, there will be certain amount of rays which are coming to you and it is going to be damaging. Like you said, you were in Sikkim, you were wearing sunglasses. I'm assuming you might be wearing a hat or you might be seeking shade.
Oh, everything.
Whenever you would have the opportunity.
Especially the snow because it reflects the sun as well.
Yes. Even swimming pools, when we start swimming, we get tanned.
Yeah.
So that is because it is reflecting sunlight. We're getting it, the absorption is more.
Is chlorine also responsible for this?
For some people who have sensitive skin, so chlorine can be little damaging, but it has nothing to do with tanning per se. We need clean water also, so chlorine is also needed.
So, like one thing I'm so curious to ask, you come from the beach holidays.
Yes.
And then you take a whole year to get that tan removed. So, so what can we do for tanning per se? So usual tanning that happens with the sunlight.
So yeah, for the preventive measures, before you're going to a beach vacation, for example, in India, you're going to Goa. So what you have to do is, what I would recommend as a dermatologist, honest opinion is don't go out in the sun as much as possible. Try to go after the hours of harsh sun. Okay, or you
गोवा जाके ये सब भूल जाते हैं डॉक्टर सुहानी गोवा जाके ये सब याद नहीं आता.
That is exactly what my patients say कि मैम ये तो नहीं हो पाएगा. I'm sorry, but yeah, you have to be little careful. If you get tanned a lot, that is one thing. Second is seek shade. Obviously, if you are going, don't go to an outdoor restaurant. आप outdoor restaurant में भी जा रहे हैं, sit in a hut, sit in a under an umbrella as much as possible.
And carry huge hats. That's what I do personally. Huge hats I buy so that वो वहीं पे umbrella बन जाता है.
Hats and sunglasses. Plus sunscreen will be obviously your best friend.
Yeah.
But you'll need reapplication again and again because if you're going to the beach, you're not just seeing the beach. You're going inside. You're having fun. So apply sunscreen before going into the water, after coming out in the water, because sunscreens are water resistant up to an extent. They are not waterproof.
They're not waterproof.
That is the biggest myth everyone has.
Okay.
No sunscreen is waterproof. It is water resistant up to certain meters. Okay. So every sunscreen has a different water resistant level. They are not waterproof, so you have to reapply after coming out of the water immediately.
So one more thing. What is the difference between tanning and pigmentation?
Yeah, so tanning and pigmentation are essentially sisters. So tanning can be immediate or after a few days of the sun exposure. So tanning is usually related to sun exposure. While pigmentation, for example, pigmentation on the cheeks might not be just because of the sun. Sun obviously is a trigger, but it can be because of hormonal issues. Maybe because you've not applied the right products. Maybe you've applied what your chemist bhaiya gave you and it led to damage more than benefit. So all those things are there.
And stress
levels, yes, it is very important for the cheek pigmentation. When it comes to lip, underarm or neck pigmentation, talking about the lip pigmentation, it can be because of hemoglobin level deficiencies or if you're doing
and
lip
smoking.
smacking and smoking. Smoking is the major issue, obviously.
Dr. Suhani, I would really request you to say something for our army family. They get so many postings. हर बार हर एक साल 2 सालों में पानी चेंज हो जाता है, एटमॉस्फेयर चेंज हो जाता है, एनवायरनमेंट चेंज हो जाता है, पूरा हवा ही बदल जाती है. At times you are on mountains, at times you are near water. ऐसे में स्किन केयर कैसे करें?
स्किन केयर हैज़ टू बी वेरी बेसिक whenever you go. Obviously जितना हार्श कंडीशंस होती हैं उतना sometimes you need certain products. For example, sunscreen, I said it is the most important thing. But basic face wash, moisturizer, sunscreen, wherever you go, even if you go to Antarctica, you have to follow. That is the most basic part about it. But see, again, if somebody has a particular concern, they can obviously ask an expert. We will be able to manage it. If they are having extremely dry skin, if they are posted in, for example, mountains or a snowy area, obviously we'll give them a thicker moisturizer to protect them.
Thicker moisturizer.
Yes. So if they have a lot of very oily skin, if they are posted, for example, in Rajasthan, they're going to sweat a lot and they have outdoor activities, obviously. We'll give them the...
So surprisingly,
mildest
Rajasthan and Ladakh, apparently what I felt, I found those too dry. Too dry.
Yes,
So
they are dry, obviously.
And Ladakh was especially, places like Ladakh, especially Ladakh, because it's cold mountains, it's cold, basically cold desert. So ये cheeks ना बहुत, no matter what you apply, ये नहीं यहाँ से cracks आ जाते हैं because the wind is so harsh.
Yes.
In such a case, what shall we apply? We usually apply very thick moisturizer. It is not even called a moisturizer. DRDO apparently came up with a moisturizer specially designed for 4Gs. So what if I'm staying not in mountains, but here where we are sitting, but I have extremely dry face. Can I use that too?
See, the thing is, moisturizers also have types. There are very thick moisturizers which we call occlusives or humectants. They absorb the moisture and keep it there.
Okay.
So you use that kind of moisturizer if you're in an extremely dry place, or even if you're in the place we're sitting in plains and you have dry skin by nature, we'll give you a thicker moisturizer which will keep your moisture absorbed in your skin for a longer time.
Okay.
But obviously if you sweat a lot, then we'll give you the mildest one.
Okay.
Yes.
And places like Assam, Arunachal, where it's so much humidity that it is like at times it's 80% in the air. What to do then?
You can...
Like you're sweating all the time.
Yes, then obviously you have to go for a drying face wash, a very minute gel-based moisturizer, which if I apply, you'll not even get to know I've applied something.
Okay.
And again, a matte finished or a silicone-based sunscreen.
Okay.
So what happens is, these three are the basic products which we have to apply. Maybe reapplication of moisturizer will not be needed in such cases.
Yes.
If you're not feeling the need to be moisturized, your skin is perfectly fine with one application, then moisturizer might not be repeated.
Right.
So a lot of patients which come to us who have oily skin, we ask them to skip the moisturizer in the night.
Okay.
It is not necessary that if I've given you a night routine, you have to follow it to the T.
So people say I have oily skin, or maybe it's like summers I don't need moisturizers, but all the time when they are sitting in a room where there's AC. So it automatically dries things up. इतना तो गर्मी नहीं लगती है. So people forget that हम AC में बैठे हैं, हमें सिर्फ ये याद रहता है कि हम summers में हैं. So how to make the balance? Like this was a question. जब हम सोते भी हैं रात में, अब लगता है कि इतना ज़्यादा sweaty हो रहा है. Why to apply a moisturizer? But in summers, जब AC होता है, is it necessary? Does it affect?
It is 100% necessary. So the thing is, we might not realize when we need a moisturizer, but that is when an expert like us comes into play. You come to us, we assess your skin. At least once a day you have to apply moisturizer, because moisturizer, don't consider it a product. Consider it a barrier.
Yeah.
So for example, as basic I can get is, we brush our teeth. It is not like we are going to get a cavity tomorrow.
Maintenance,
we might not
basically.
get it in 1 month also.
Yeah.
Okay. But we might eventually get it if we don't brush our teeth.
Yes.
So you have to apply a moisturizer because it is forming a protective film around you.
Yeah.
So any allergen or any infection which is going to come, at least you'll have some kind of protection.
Yeah.
So in the COVID era, we went crazy about sanitizers.
Yeah.
Like how much ever it was helping us. Moisturizer is a sanitizer for you, which is already given to you. So moisturizer has to be there, has to be in your skincare, but it depends the reapplication according to your skin type. You might not need it 3-4 times a day, 3-4 times a day, but at least once it is needed.
Okay.
If you have dry skin, obviously we'll give you a thicker one or we'll give you reapplication.
So there are how many types of moisturizers?
Moisturizers are mainly humectants, occlusives and emollients, but that is a very technical part of it.
English में बताइए please.
So just go about it. There is a thick moisturizer and a thin moisturizer.
Okay.
Depending upon your skin, when we will assess it, we'll tell you what moisturizer suits you.
Basically, I've heard about 2 types, water-based and cream based. At least makeup point of view से मुझे ये पता था.
Yes.
Is it right?
It is right. That is the formulation part of it. पर उसको समझना is very technical for all of people. अगर मैं layman हूँ, अगर मैं डॉक्टर नहीं हूँ, मुझे नहीं लगता मुझे फर्क पड़ेगा कि मैं वाटर बेस्ड यूज करूँ या क्रीम बेस्ड करूँ. मुझे वो फर्क पड़ेगा मेरी स्किन पे क्या सूट कर रहा है, जो मुझे स्वेटिंग नहीं दे रहा है, या फिर अगर मेरी ड्राई स्किन है जो मुझे अच्छा लग रहा है.
Right.
करेक्ट. तो मोस्टली जो ऑयल बेस्ड या क्रीम बेस्ड होते हैं वो थोड़े थिकर होते हैं. ऑयल एड्स थिकनेस. जो वाटर बेस्ड होते हैं वो थोड़े थिनर होते हैं. तो इट डिपेंड्स कि
Absorption भी जल्दी
absorption जो
Is there a particular way I can apply this?
It is a very basic thing. What I usually tell my patients, don't use your palms because half of the product remains there. Like we don't use makeup on our palms. Like we don't apply the product from our palms. Use your tips. Go away from the midline.
Maybe in upward motion.
Yeah. Maybe the lymphatic drainage helps. Certain studies have told that.
Right. So men, women, all of us do that. हम अपने हाथ में product लेते हैं, we do this and we apply.
Yeah, so obviously.
And at times either we just apply and leave it, or we just keep rubbing it on our faces.
Yes.
Don't do that. अगर आपको product लेना भी है एक बार ट्यूब से, तो take it here. At least यहाँ पे lines कम होती हैं, तो it doesn't go in. But personally, I do.
Yeah, you can use your tips. Tips are the best thing. Even you can, like you do with your makeup, you use your tips. You can use your tips for the sunscreen, for the moisturizer.
Right.
You can just rub it here and you can apply it.
Right.
We've seen the memes on Instagram where men we are taking it and they're just rubbing it and applying it, and the wife is going crazy seeing that skincare routine.
At times men don't even think it's necessary. Sunscreen is not for men and women. Sunscreen is a protection everybody needs for the skin. As Dr. Suhani said, 6 महीने का जो बच्चा होता है उसके बाद से sunscreen necessary हो जाती है. तो how can you say कि I'm a man, I should not apply it? It's not skin, it's not makeup, it's skin care. And you have skin, right? You carry a skin, so you need it. It's as simple as that. Now next is how to choose a face wash.
Okay, so face washes also, there's a huge range obviously. Again, everything comes to the skin type. So if you have an acne prone skin or an oily skin, you have to go for a face wash which maybe has a drying component, which mostly is salicylic acid. I did not want to touch on the molecular part of it, but usually what happens is the drying agents which are in a face wash, they will at least remove the dirt and the oil. That is the basic thing. You have to go for an oil-free face wash if you have oily skin.
Okay.
If you have a drier skin, you can go for a creamy based face wash.
How many times shall I wash my face? During winters, during summers, during monsoons?
Yeah, so there's no particular time on the basis of the seasons. Minimum is twice, but if you're feeling very sweaty, if it is a lot summers are happening, and of course you can wash it as many times as you want. For dry skin, we ask them to not wash it more than 2-3 times, because again it might take away the moisture.
So if the heat is too much, don't use the face wash, just splash some water on your face. That
is also perfectly fine. Yes.
Okay. So Dr. Suhani, what is a basic morning routine and night routine for everyone?
Yeah, so like I said, the basic 3 things are there: face wash, moisturizer, and a sunscreen.
In the morning?
Has to apply it.
In the morning. When you remove it, you don't need sunscreens at night. So what should be my night routine especially?
So the thing is ki somebody who has a lot of screen time, maybe who is working in a call center, maybe who's working according to the international timings, they might need a sunscreen in the night also.
What are you saying?
If they are in front of a screen, yes.
So if you're in front of a screen all day long, you need a sunscreen. But if at night you're using a screen,
yes, you might need a sunscreen again.
And people do work at night.
Yes.
Even those who don't need to. कि मुझे ऐसा होता है ना कि मेरा suppose I'm doing something creative, कभी-कभी ऐसा होता है कि when everybody sleeps, somehow your brain starts working at night. Personally, when I'm writing something, when I'm creating something creative, I always say sleep on time, but मेरा भी mind उसी time पे चलता है for some reason. So in that case, I have to apply it. Right?
Yes.
Okay.
So when it comes to a night routine, again the face wash is important because you have to remove the dirt that you've carried all the day long. Then a moisturizer, if you're feeling that you need it. If you're feeling very oily, you can skip it also.
Usually AC में होता है तो moisturizer I do take care that I should
then
apply.
You have to use the moisturizer. This is sufficient if you do not have a particular skin concern.
Okay.
So this is my routine. If I don't have a concern, if I'm not having breakouts, that is what I do. A face wash and moisturizer and I'm good to go.
Okay.
But if you have an oily skin, obviously we'll give you certain actives. Actives are the molecules which are given to act on the skin, the current skin. So that you'll have to use according to the recommendation of a dermatologist.
Fine.
For a general skincare routine, if you want an anti-aging routine, then obviously you will have to use an anti-aging serum or a cream at night.
At night.
Yes.
But what shall be the routine? Like we are too obsessed with CTMs. At least for makeup we do use it. But at night, before sleeping, of course makeup removal is the most important part. I always say this to my sisters, जब भी आप makeup लगाओ, makeup लगाने से ज़्यादा important है makeup को remove करना और सही तरीके से remove करना और completely remove करना. What happens is at times you don't remove it properly. In the morning आपके pores में चला जाता है and your kajal and your eyeliner come still here and you look like a bhoot. So you know, so how to remove your makeup? एक अच्छे makeup remover में क्या होना चाहिए?
So yes, removing the makeup is very important, like you said, because it will clog your pores. It will obviously make you look hideous in the morning. But yes, it is important to remove it. So the thing is, as dermatologist, toning is one thing which is little unpredictable, and we don't recommend it per se.
Is it?
I don't think
okay, so people who are obsessed with CTMs, like cleansing, toning, moisturizing, and for toners, seriously, like how seriously shall we take toners?
Yeah, so as a dermatologist, I don't think so any dermatologist will recommend a toner for everyone.
Okay.
So if
because
you have,
it dries you up.
Yes. If you have a normal to dry skin, I don't think so you need a toner.
Okay. If you have normal to dry skin, don't use a toner. There's no need for it.
Yes. So cleansing is important. Moisturizing is important. Toner is only for the people who need it. Otherwise, it can be easily skipped.
Who needs a toner?
Only if you are applying a very oily makeup, oil-based makeup. If you are applying thick layers, if you are learning makeup and professional makeup, you have to go for the layers. Then you might need a toner, but it is not necessary.
So there's one thing, Dr. Suhani. Personally, I have seen this. This does work. I don't know how good it is for the skin, but when you apply a cleanser, you've cleansed your face. Now you're applying a toner. You need your open pores a little closed because otherwise the layers do show. You know, so in that case, does a toner work? Personally, how much toners work for open pores?
Yeah, the thing is that all the toners don't work. The toners which have specialized molecules to dry the skin or maybe close the pores, which I'll say. For example, if there is salicylic acid in a toner, then it will work for you. Okay. But that is the scientific part of it. If you're using a face wash with the salicylic acid, it is going to work the same. Okay. Why do you need to add a toner to your skincare if you're having it in your face wash? Again, if you're having certain molecule in one product, there's no need for another product. Okay. But when it comes to makeup removal, double cleansing is very good. So what does double cleansing mean is, because normally we have not applied anything on the skin, but with makeup we have applied a few layers. So you should you should practice double cleansing, which is cleansing with a micellar water. That is an oil-based
micellar water is oil-based.
Yes, that is perfectly normal. I use it. I recommend everyone to use it. So oil-based, it is an oil-based cleanser, as we know, micellar water. So you remove the excess makeup with that. That is the first layer. If you just sleep after doing the micellar water, it is a huge mistake. Then your pores are not going to be open. Pores are not going to be cleaner. So then you have to use a face wash.
So that is double cleansing, you said?
Yeah. So that is double cleansing.
So Dr. Suhani, what I personally do is, I use it twice, like micellar water. एक बार layer हटा दिया, I'm not satisfied, I'll do it again. But again, there's one thing people do, they actually scratch their faces with it. बहुत harsh sponges लेके या फिर बहुत जो tissues होते हैं हमारे at times, the cleansing tissues, at times वो बहुत harsh होते हैं, the facial tissues I'm talking about. Easy बहुत होता है कि एक बार में उठाया and you just wipe it off. But I think you must go for a very soft sponge, or you must go for cotton. At times cotton is also harsh. कुछ cotton rolls जो होते हैं वो बहुत harsh होते हैं. Cotton pads are way better, right? Way
better, yes. So you can go for cotton pads or the softer cottons. One thing I want to add is you should not go for the fragrant tissues.
Fragrant tissues,
yes. Okay. So fragrances are anyways allergic to all of us. Now you'll see.
And we are obsessed with fragrances.
Yeah, we were more obsessed, I think, earlier. These days, the famous products and very good skincare, even the most expensive products, are non-fragrant. Because that has changed over the years. The researches have come that fragrances rather cause allergies in people. Okay. So again, the fragrant tissues, one is there is fragrance. Another one is you are rubbing it vigorously and scratching it. So that will add to the damage.
So it is tempting. Fragrances to girls at least are tempting. Like जैसे हम कोई bottle खोलते हैं और we are just so tempted. कभी-कभी उसकी ज़रूरत भी नहीं होती and we just buy because fragrance अच्छी थी. So let's not do that. So while removing makeup, I clean it twice in 2 parts. एक बार पूरा face wipe off करके with micellar water. Again, I do it with a very soft sponge. After that, I wash my face with my regular face wash. After that, I apply a sheet mask because I want to restore the moisture. Yes. So I sleep at times. तो एक दिन तो मुझे 2 घंटे बाद नींद खुले ना कि face पे ही था मेरे. So you tell me how does it work? How much it works? The sheet mask especially.
The sheet masks mostly give you a feel good factor, as much as basically I can put it. Okay. it is not like you will use it every day and you will turn into Cleopatra. No, it's not going to happen. But it is a good feel-good factor. It gives you hydration. It gives you that coolness. So you can apply it. There's no harm. But don't think so that it will replace your skincare.
Yeah, of course.
So even we do medifacials in our clinic. We also apply a sheet mask which is collagen based, but it is not the only aspect of the process.
Of course. At times, मेरा shoot बहुत लंबा चलता है. Makeup, lights, everything's there. So I have to, you know, वो अच्छा feel good factor तो देता है मुझे. I was always curious to know, Dr. Suhani, how to apply a sunscreen with makeup. Suppose I'm going, बहुत ज़्यादा sunlight है, right? मेरा एक noon time का कोई event है, around 12 or 1. It's harsh sunlight. तो मैं sunscreen कैसे लगाऊं? और फिर makeup के साथ उसको कैसे लगाऊं? Like पहले लगाना है, बाद में, what is it like?
So you will be surprised to know I am wearing a sunscreen on my makeup right now.
On my makeup, you said.
Yes. So
after the makeup,
whenever you have to apply a sunscreen, that part goes in the last. So
but that messes up with the whole shade. Come on, that's
maybe your sunscreen is not right for you, ma'am.
Acha, that white sheen comes. That's why I said.
It's okay, na. Whenever you're applying makeup, you're anyways giving a tint to your skin.
A layer, you can say. Or
a
not?
layer. You obviously you're layering your skin with makeup. So
but
if you apply a sunscreen. Even if you can use the sheen one, because it will give you a shine and it is temporary. The sheen goes off. It is not like it is going to stay for the whole day.
Right.
You can do that if you like it, as per your skin. If you don't want a sheen, use a chemical sunscreen. You will not even get to know. There are certain sunscreens which are gel-based sunscreens. When you apply them, you will not even know you've applied anything. Okay. So they go very perfectly with makeup.
So gel-based sunscreens bhi hoti hain, that's good.
Yes, it is silicone-based sunscreen. They are very transparent.
Okay.
They are like just like a transparent gel.
So basically, it won't mess up with my shade.
Yeah, they
with my makeup shade.
Yeah, if you're using silicone-based sunscreens, they are transparent. Absolutely, you'll not get to know you've applied anything.
Okay.
But it is 100% recommended to apply a sunscreen over the makeup.
Over the makeup. Okay.
Yes, you should.
Okay. So पहले मैं कभी-कभी सोचती थी makeup हो तो गया, अब इतना मोटा layer है, इसके बाद क्या करना है sunlight में, but it's not right.
Yes.
Now let's come to the most famous, the most controversial, I would say, Korean skin routine, especially the eyes. जो लोग सुबह उठते ही, कटरीना का स्किन केयर रूटीन आया था few years back, तो लोगों ने सीधे आइस का बोल उठाया उठते ही नींद में, they dipped their faces in it directly. How right is that? How does that work?
See, the thing is, again, that is something that is like a temporary hack which everyone is using. Even Ranveer Singh posted about it. Katrina Kaif, like you said, posted about it. So in the morning when they wake up, sometimes because they have night schedules, they have puffiness. So ice water, what does it? If you put your face in the ice water, it will reduce the puffiness temporarily. So if you want that temporary effect, you can do it, but it is not highly recommended. If you have a dry skin, it is going to suck out all the moisture.
Yeah.
So that temporary hydration is not going inside your skin. For that, it is better to use a moisturizer. Right. So it is just a hack.
But Dr. Suhani, for photo shoots, even I have done that, and it has worked for me. At least the puffiness. Since I don't have too much of puffiness, it helps with the pores for some time.
Yes, because that is why it is happening. Is because the cold water, it will cause vasoconstriction.
Of course.
That is, it will constrict the blood vessels, so that it will be tightening of the skin. So
थोड़ी देर के लिए तो feel होता है.
तो थोड़ी देर के लिए, if you have a professional shoot or if you have to meet somebody, you want to have to like feel that you have a tighter skin. You might not be having it. It is temporary. You can do it. So it is okay. But for dry skin, if somebody comes to me with dry skin and asks if they should do it, I would not recommend it. If it is working for you, it is okay.
Because it can cause cold and cough. I've seen people doing it और फिर सर्दी हो जाती है and they're like क्यों हो गई? So the moment you wake up और सबसे पहली चीज़ आप कर रहे हो dipping your face in the ice water, it can harm your face as well as your health overall. Under eye cream कितना काम करती है?
So yeah, let's face it once for all, it works only 20 to 30%. That is only because see, under eye darkening is a very complex issue. You might be having it genetically. So if somebody has a genetic dark under eyes, it is very difficult to get rid of them. Your genetics play an important role in the skin tone that you have. So if your mother or your grandmother or your father's side have had dark under eye, you might be having it. So the under eye creams will help you to an extent. That is 20 to 30%. You might have to go for advanced procedures to get a lot of improvement, but I don't think so there is 100% improvement with anything. Okay. Even if it is always temporary. So there are exfoliants, there are creams, there are chemical peels, there are lasers. we do it regularly. And if you have a proper trough is like a gadha. If you have sunken eyes and there is no fat in this area, how much ever you apply cream, how much ever you apply moisturizer, it's not going to help.
So it's not actually pigmentation, it's a sunken eye, क्योंकि आपके यहाँ पे fat नहीं है.
So there is a method where how we can know if your eye is pigmented or is it sunken. So what you do is, sometimes our eyes appear sunken, but if you pull this area, the cheek below,
like this,
and your pigmentation goes away, then it is the little pigmentation that you have. But if you're pulling it and still that trough is there, it is not going away. It is a gadha.
It is a gadha.
So you, like a gadha in the road has to be filled with cement, the same gadha if we have has to be filled with a filler.
Okay.
So
कितने अच्छे से समझाया आपने. Seriously, it was very good. Okay, so if you have a gadha or you have pigmentation, whatever it is, पहले तो वो identify करना है. People are usually people who have dark under eyes, be it pigmentation or the turf, थोड़ा सा disturbed रहते हैं इस चीज़ को लेके कि मेरे dark circles मेरे पूरे facial features को खराब कर रहे हैं, right? So in that case बहुत ज़्यादा disturb होने की ज़रूरत नहीं है. First you can't fight your genetics. सबसे पहला तो reason ही sleep होता है, right, Dr. Suhani?
Sleep and stress.
Sleep and
they
stress.
both go hand in hand. So if you are not improving those things, no doctor or cream is going to help you. Absolutely, it is not going to help you. You have to change your lifestyle, even nutrition, for that matter.
Right. Does filler work?
Filler? Filler works wonderfully if you have that trough. If you have that gadda, filler works amazingly well. But again, it only stays for 6 to 8 months. You have to get it done again and again.
Of course.
Yes.
और अगर ये सिर्फ pigmentation, it's not turf, then you could actually learn some makeup tricks and you can actually hide it through that.
Yes.
Right?
That is, if you have to be in that environment where you cannot afford to hamper your appearance with those dark circles, obviously makeup can help again temporarily. If you have pigmentation, get it diagnosed, meet an expert. They will make you aware of the things you might be going wrong. Yeah. So we'll make you aware first, then we'll give you creams. Obviously, something is better than nothing. So 20 to 30% improvement happens with creams. Then we can take to one step higher, then we can go for certain procedures. Non-invasive, no injections. Lasers can be there, chemical peels can be there. That will give you a 40-50% improvement. If you want to fill 100%, or if you want to get the pigmentation better, then it is better to go for a filler, provided you're not phobiatic of needles, because it is painless. It's not like it is a lot of pain. You can go for that. So that clarity will only come if you come to an expert and ask about the options. Always have and discuss the expectations with your doctor first. Don't go madly after a friend or a family member or somebody, some distant relative who has gotten something done and has worked for them. It might not work for you. It might not be what you are expecting.
Right. So you said madly going after something. So these days what we are madly going after is, there are a few things. The product mela, I call it these days. The moment you're on the internet and anything you've seen about skincare, there would be retinol, salicylic, glutathione, glycolic, hyaluronic, vitamin C, niacinamide, collagen. होता ये है Dr. Suhani that what people think, ऐसा कोई product लूँ जिसमें सब कुछ हो. I know it's not right, but why it is not right, please tell me.
So the thing is कि mixed masala will not work. There is absolutely no science behind it. So the thing is, I understand the problem. Even I'm putting social media reels, and we have seen a lot of dermatologists and influencers for that matter put a lot of skincare. The problem is, if I'm a layman, if I'm not a doctor, अगर मैं एक आम इंसान हूँ जिसे कुछ नहीं पता skincare का, it is very intimidating and confusing. अब glycolic, salicylic, niacinamide, vitamin C, retinol ये क्या होता है? I don't know. But obviously, अगर आप blindly एक famous influencer या एक famous dermatologist का recommended product लगा रहे हो, without knowing the science behind it, तो उसमें गलती उनकी नहीं आपकी है. Right. They are creating a doubt. They are not wrong. They are giving you information. अब अभी हम इस era में post COVID भी and since the past 1 decade, we are blessed that we have the information. हमसे बड़ी generations को तो पता ही नहीं था ये क्या होता है, कि exist भी करता है. Even still they don't know, who are not on social media.
And somehow Dr. Suhani, उनकी skin बहुत अच्छी कैसे है? I don't know. They haven't applied anything. वो लोग शायद facials भी नहीं करवाते थे time पे.
हाँ, मतलब the thing is कि obviously too much information, like I said, can be intimidating और सब कुछ नहीं चाहिए हमें. हाँ. ठीक है, you see those reels, you see it, gather your points, ask your doubts to an expert कि मुझे retinol कब लगाना है, या मुझे salicylic चाहिए कि नहीं, मुझे glycolic चाहिए कि नहीं. Again, if something has worked for someone, it might not necessarily work for you. Right. it is a product mela, it is a mixed masala things which are happening, but we as skincare providers, we just want to create a doubt in your mind ki these products, these procedures, these fillers, these everything is available. But you come to somebody, ask if you need it, you tell your concerns, then we'll be able to help you. Now the thing is, what is happening is people are expecting हम ये भी ले लें, वो भी ले लें, वो भी ले लें, सब कुछ काम कर जाएगा. Obviously सब कुछ काम नहीं करेगा. अब आप एक सब्जी में सारी सब्जियां ही डाल दोगे तो अब वो क्या टेस्ट, किसका टेस्ट आएगा, तो आपको टेस्ट किसका आ रहा है? Right. It is the masala taste you're having, है ना?
So patients come to you with these problems और आपसे पूछते हैं कि मैम ये भी लगाती हूँ, ये भी लगाती हूँ. Do you see this?
Every day I see every day I think 5 to 6 patients who bring their products. I would not name the companies. कभी किसी कंपनी का रील देखा हमने, this promotional reels, हमने ये भी ले लिया, ये भी ले लिया, ये भी ले लिया, मैम काम तो करा नहीं. But उनको पता कैसे चल रहा है कि ये उनके लिए है कि नहीं? They have to come to me. And I am one person. अगर मुझे लगेगा कि उन 5 प्रोडक्ट में से एक भी उनको अगर काम करता है, मैं उनको कहूँगी कि आप ये कंटिन्यू कर सकते हो, आप ये नहीं करोगे, इसके अलावा आप ये सब कर सकते हो. Obviously अगर कोई प्रोडक्ट बना है तो वो गलत नहीं है. अगर कोई उसको प्रमोट कर रहा है, वो इंसान भी गलत नहीं है मेरे हिसाब से.
So in this area of consumerism, consumption, we are consuming so much, but now we should be really mindful of what we are consuming, especially from the skin point of view. हम जो खा रहे हैं उसकी तरफ हम ध्यान देने लगे हैं. अब स्किन के लिए भी देते हैं. बिल्कुल कुछ भी नहीं लगाना और जितना मिल रहा है सब लगा लेना. Let's save ourselves from these two extremes, right? Skin issues in, brief. Aging and wrinkles. How to fight this?
So you can prevent them. So if you want to prevent aging and wrinkles, start by the age of 28-30.
अच्छा तभी से start हो जाती है?
Yes, you have to start by at least vitamin A derivative creams or serums by not naming a product as per se. So you should start them. They will prevent the aging. Basically line आने से पहले उसको हटाना is easier than line आने के बाद हटाना. Even if you have heard about a procedure called Botox, जब हमारी लाइनें गहरी हो जाएंगी, हमारे रिंकल्स गहरे हो जाते हैं, तो बोटॉक्स कुछ एक लिमिट तक ही काम करता है.
Okay.
बोटॉक्स इज नॉट टू बी डन कि जब हम बूढ़े होना शुरू हो गए हैं या बूढ़े हो चुके हैं तब हम बोटॉक्स करा लेंगे, ऐसा नहीं होता है.
Okay.
या हम तब एंटी एजिंग करा लेंगे. See, not just Botox, a lot of procedures, machines, there are anti-aging procedures, machines, everything is there, but you have to start early.
Early as in how early?
By 30. So what I feel is when the moment I will turn 30, I am going to start everything because it is up to your choice. If you don't want to grow old, you should start early.
So Dr. Suhani, you will start because you have your own home, your clinic, right? How to choose the right doctor to do this?
So any dermatologist who has a qualified degree, any certified dermatologist you go to, they will be able to help you. Dermatologists will not just give you everything blindly because you are their patients. They also want to create a bond with you. They are not going to mindlessly give you products. Right. Whatever you need, you give your expectations that you just want to prevent aging. Okay, then they'll be in that zone. If you have started feeling wrinkles and lines, then they'll be little aggressive. So if you are too way beyond it, they will tell you कि how much expectation you should have with the treatment that they're giving you.
Right. और जैसे आपने बोला था इसीलिए तो हमने 10 साल पढ़ाई की है. That's why we are here. So aging and wrinkles हो गए. Now the major problem of an oily skin. 2 major problems: open pores and pimples. Pimples or acne, whatever. So open pores and pimples. How to fight this?
So see, one thing we have to understand is कि pores सब में है, मुझ में भी में है, आप में भी है. Pores are nothing but openings of our oil glands. तो वो सब में होते हैं. अब वो किसी के pores बड़े क्यों हो रहे हैं कि अगर वहाँ पिंपल हो रहा है तो वो उसको expand कर रहा है. तो first thing, if we fight the oily skin and the pimples, तो open pores इतने नहीं होंगे.
Okay.
That is one thing we have to understand. So that is why skincare starts early. If you have oily skin, if you are getting acne, you are bound to get open pores अगर आपने उसको timely manage नहीं करा. तो acne का बहुत ही simple से treatments and there are a lot of treatments available. You meet your dermatologist, एक skin care routine start कीजिए. किस severity के pimples हैं उस हिसाब से a doctor will recommend you products.
एक चीज, pimples are not only because of oily skin. Pimples are because of hormonal issues, PCOD, pollution, and what else?
Obviously, so pimples are not just because of oily skin. People with dry skin also can have pimples. Yeah. So hormones play a big role.
Especially during puberty?
Yes, puberty, because we have that growth spurt. All the hormones are active. Our oil glands become active at puberty. So you tend to get a lot of acne. Then your diet is very important. Okay.
So oily diet से दूर रहना है.
Oily, sugary diet से दूर रहना
Oil and
है.
sugar. Okay.
Oil, sugar, preservatives.
Preservatives.
These three things you have to avoid.
And you have to keep your digestion clean, like super clean. Yeah.
Yeah, obviously. Then stress issues. If you keep changing environments again and again, that is a stress on your skin as well as your mind and body. So that also plays a major role. So acne या pimples को ठीक करना उसी time पे is important ताकि उसकी complications भी ना हो. So acne marks and acne scars या pits जिसे हम बोलते हैं वो acne की ही complication है.
Okay.
If we are not treating pimples currently, how will we treat the complications?
Right.
So open pore is basically a complication of acne.
Tanning from sunlight.
Yeah, so tanning from sunlight, like we've discussed, I think sun protection. So that is physical.
No, not that. Dr. Suhani, जब tanning हो गई है, how to remove the tanning?
So once tanning has happened, again you need a sunscreen. Because it is a continuous process. The more you will go out in the sun, the damage will continue. So one is sunscreen.
Sunscreen would lock it and protect it.
Lock it and
how
protect it.
How to remove it? The Goa wala tanning that I'm talking about.
So there are a lot of depigmenting creams which are available, but it is a long list. Okay. Obviously. So you meet your dermatologist. We'll see the amount and the depth of the tanning. So we can go for creams. We can go for exfoliation processes. Exfoliation means removing the dead and the tanned layer. Okay, but it has to be done under supervision. So that is one thing. And then of course there are lasers if there is too deep tanning. So we can go for that. Okay.
So one is that tanning ko hatane ke liye what people do is they scrub a lot and blindly every day they scrub a lot. And I've seen people using scrubbers on their faces every day. So how right is scrubbing? How mild should be scrubbing? How intense should it be? For what skin types? What is scrubbing? Tell me. Which is exfoliation that you said.
Yes, so basically exfoliation is removing some dead or dirt skin layer. But scrubbing is different. Scrubbing is vigorously doing it. It brings more damage to the skin rather than exfoliation.
What kind of damage?
So basically the thing is there are layers of the skin. So if we scrub it too much, we are actually activating the pigmented cells. So there are certain skin problems which happen because of scrubbing. So if a person comes to me with that certain problem, it is called macular amyloidosis. Not going into detail.
Wow. It's very easy to pronounce.
It is if somebody is coming with a pigmented patch. For example, if there's a pigmented patch on this arm, if somebody is coming with me, coming to me with this, first thing I'll ask is, do you use a loofah or do you scrub it? So that is a major problem. We are actually increasing the pigment.
Okay.
So what people might not know is that our skin is shedding periodically every time. You might not see it because it is micro shedding. Every 28 to 30 days, our skin cells shed them itself. Okay. So if we are regularly scrubbing it, we are hastening the process. So our skin is not getting repaired. The pigmentation is increasing.
Okay. What about body polishing that people get done in salons? So usually body polishing, they scrub the whole body like thoroughly, properly. How right is that?
So those patients, they come to us only with increased pigmentation. Let me tell you. So body polishing should not be done. Scrubbing too much is not going to help you. Okay. Maybe exfoliation helps in certain conditions. If you have a very, I would say, thodi khurdari skin, that it helps. But it is not for everyone. And you can't do scrubbing every day. That is for sure. Maybe once a week or once in 15 days.
Like if you have extremely dry skin, किसमें ज़्यादा build up होता है? Dry skin में, oily skin में?
So dry skin, तो it is a big no. Any trauma to the dry skin is going to increase problems for you.
Okay. So oily पे फिर भी थोड़ा सा
yes, even patients, even people with dry skin, even they cannot take baths more than 10 minutes.
How frequently they can use maybe a soap or shower gel or whatever?
So the frequency also matters. Obviously the minimum. And the pH also matters. Okay. So if you have extremely dry skin, the pH of the soap that you're using should match your skin. Okay. And you'll be very surprised to know if you see the back of your soaps which you are commonly using, they're very harsh for our body. Okay. So especially people who have dry skin, they should go for a pH balanced soap or body wash only. Okay. And bathing not more than 10 minutes.
Not more than 10 minutes. Yes. Okay. Even in summers?
Whenever.
Okay. One thing, waxing that we get done. Okay, so there's n number of, there are so many types of waxing these days. Any special tips that you want to give, pre-wax and post-wax?
So few points, as a dermatologist, we don't recommend waxing too much because again, it is a trauma to the skin.
Too much as in?
Too much as in we don't recommend waxing.
You don't recommend waxing?
No, we don't. We, as a dermatologist, we want to protect the skin. Skin is the largest organ of our body. We should not give any trauma to the skin. Especially if you're prone to pigmentation or if you're prone to something called ingrown hair. We don't recommend waxing for such people. But still, if you want to go for it, there are certain tips you should follow. Number one is you can moisturize the skin right after the waxing and before it also.
Before it, तो फिर wax होती कहाँ है?
But you can give a gap. You have to use a moisturizer in the morning if you're going for waxing in the evening.
It's been ages in salons. They say that don't apply any moisturizer if you're coming to us. No body lotions, no oils. At least 24 hours before you're coming to us.
That is because the waxing is basically giving trauma to the skin. So their method of removing the hair is not going to work if your skin is little slimy. But what about the protection of the skin?
But then the hair doesn't come out.
Yes, because that is why we don't recommend waxing. So what is happening in waxing is we are basically pulling out the hair.
Yeah.
That is not recommended for your skin. You're pulling out your hair. You should ideally not do it.
What is the alternative?
I think the safest method, if you don't want to go for a laser hair reduction, because it might be expensive for somebody or you might not be aware that it is available, the safest method is shaving. That is the biggest myth. People think that they get thicker hair.
And ingrown hair?
Ingrown hair, people have to go for laser hair reduction.
Okay.
There is no alternative. The more they'll go for waxing, the more pigmented they're going to get.
But you're saying shaving, like literally shaving.
Shaving is a very safe method of hair removal.
We've been taught against it all the time.
That is the myths we are here to break.
Yeah.
Because what happens is, I'll tell you, if you use a shave with a multiple blade. So there are tips obviously for shaving also. If you're using a shaver with multiple blades, basically you're breaking the hair at different levels.
Right.
Okay, so the hair which is here might not be broken at the surface level. So it might be little above the skin and you will feel that it is thicker.
Yeah.
Okay, because it is cut at a certain level.
Right.
So what we counsel the patients is, if you're using a shave, use a single blade one. Never shave on dry skin. Always use a moisturizer or running water and then you shave it off. It is the safest method.
Because you're not pulling it off.
Yeah, it is the safer method as compared to the other things.
Okay.
Other things which I'm comparing is waxing and epilation.
Epilation also.
So waxing,
but you're saying epilation is not good.
No, again you're pulling out the hair. You're damaging the follicle. 100% if somebody is listening to us and has done epilation, might have had a bump there. It is very common. So out of waxing, epilation and shaving is the safer method. Okay. People have that myth that the hair get thicker. It is not like that. It is just being cut at different level. That is why you're feeling it thick. It is not getting thicker.
Okay.
Again, you can shave it off. It will be smooth only. So that is one thing. So for waxing, if you're getting waxed, after waxing you have to apply moisturizer. Some people again get few bumps immediately and redness after waxing. Waxing is not for them. Still, if you want to go for it, you can use moisturizer. That is one thing. If the redness is not going like say within 15-20 half an hour 20 minutes or half an hour, you have to see a dermatologist. We'll give you anti-inflammatory creams for it, but we don't recommend it after every wax.
Okay.
Because ultimately it is damaging.
Okay. And what about waxing in intimate areas?
So basically the thing is that intimate areas have hair because of a reason. They give safety to our body. So it is not necessary to get rid of them. They are there for some reason. But cosmetically, obviously, if we don't like it, we can get them removed. But waxing might lead to a lot of small bumps, which is folliculitis.
What is the best way then?
The best way is laser hair reduction for intimate areas, 100%, even for underarms, even for the pubic hair. Anywhere where there is delicate skin, laser hair reduction is the best and the safest method.
What about facial hair?
Even facial hair, what happens is, a lot of people would be saying that we get waxed and we are okay. But the thing is, the more you're pulling your skin, the aging effect is going to go like this.
Also, I've seen people with a lot of pimples when they get wax done.
Again, the same method. Wherever there is hair and if you're removing it with a wax, there is going to be a bump. There are a lot of videos for it on YouTube or any social media. Whenever you're pulling, even if you pull a thread from your dress, it might damage it.
Yes.
So if you're pulling your hair from any place, you will get a bump. So when it is on the face, it is acne. And we get more bothered. A lot of people with acne prone skin, they come to us कि मैम wax कराया था, acne बढ़ गए. You can't wax. You cannot do it.
What about threading?
Threading for a smaller area is still fine, but again it is giving micro traumas. So for a smaller area,
So this micro trauma that we take like what 3 times a month, it's not
yes,
right?
It is absolutely not right, not recommended. But
so laser hair reduction?
Laser hair reduction is the safest method. There is no.
But that doesn't happen
skin.
around the eyebrows.
It does happen. A lot of machines have come with a specialized probe. It does happen. In a particular shape which you want to get it done, everything is possible, ma'am. I think skincare and the science has grown too much in the last decade.
Right.
And absolutely for the face, we don't recommend waxing. If you can't do a laser hair reduction,
what about bleach? Bleaching your face.
You can go for shaving. Bleaching is a temporary method.
But is it safe? People who are going for it, कुछ लोगों को obsession होता है bleaching से.
See, the thing is कि what is happening is bleaching only works for them who have little hair over the face. What bleach is doing is it is temporarily lightening the color of the side locks,
right,
or the hair that you have. A person who doesn't have hair on the face, bleach will not work for them.
It's of no use. No,
it's of no use.
It is of use. People think they get a fairer tone with a bleach.
The fairer tone is because that color that has bleached your hair is reflecting that tone.
Acha.
So if you remove that hair first and then you bleach it, you might not have a very good improvement that you are expecting. So bleach is okay for the people who have done it, but it is not a long-term recommended thing.
Okay.
It is better to go for science-based peels, which a certified doctor
basically
will
medicated peels.
Medicated peels. They work fine. They don't damage your hair. They don't damage your skin. So I think that is better to go for. Obviously, bleach is not recommended. Anything which is giving trauma or temporary oxidation to the skin, micro traumas, macro traumas, all those things are not recommended.
Okay. 3 kinds of people. 1, every month facial. Salon में appointment book करके every month उसी rate पे facial होता है. Second type is मैंने बहुत दिनों तक अपनी skin खराब की for 3 months, 4 months straight and now I want to get a facial done क्योंकि घर में कोई event है. कुछ लोग बिल्कुल ही facial नहीं करवाते हैं. Which type is right?
It depends. The thing is touching on the first person कि जो हर महीने facial करवाते हैं. See, the thing is one has to understand कि facial एक temporary चीज़ है, ठीक है? कुछ बुराई नहीं है, कुछ अच्छाई नहीं है, ऐसा नहीं है. अच्छाई है मतलब कि अगर आपको एक temporary effect चाहिए तो facial में कोई harm नहीं है, provided जो आपके facial कर रहे हैं उनको पता है आपकी skin कैसी है. अब facials चल रहे हैं बहुत age old टाइम से और लॉट ऑफ पीपल हैव बीन डूइंग फेशियल्स, उसमें कोई प्रॉब्लम नहीं है. हर महीने अगर आप एक फेशियल करा रहे हैं जस्ट कि हाँ एक फंक्शन है उससे पहले हमें ग्लो चाहिए, देयर इज नो हार्म अबाउट इट, प्रोवाइडेड योर स्किन इज नॉट वेरी ड्राई या बहुत एक्ने नहीं है कि डैमेज नहीं हो रहा, उसका कोई साइड इफेक्ट नहीं आ रहा, कोई रैशेज नहीं आ रहे, तो जो लोग को सूट कर रहा है वो फेशियल्स करवा रहे हैं. अब क्या होता है कि कई बार हम ऐसा फेशियल करवा लेते हैं और हमने फर्स्ट टाइम कराया या हमने 10th टाइम कराया, ज़रूरी नहीं आपको फर्स्ट टाइम ही रिएक्शन आएगा, आपको 5th टाइम भी आ सकता है, आपको 100th टाइम भी आ सकता है. इट इज़ बिकॉज मे बी दैट प्रोडक्ट वॉज नॉट सूटिंग योर स्किन एट दैट टाइम, इट कॉज्ड समथिंग टू यू एंड यू डिड नॉट रियलाइज आपकी स्किन को वो नहीं चाहिए था उस टाइम पे. तो दैट इज़ व्हेन अ लॉट ऑफ पेशेंट्स कम टू अस दैट दे हैव गॉटन अ फेशियल डन एंड उसके बाद दे हैव कम विद फुल ब्लोन एक्ने. तो दैट इज़ द प्रॉब्लम. You should realize when you want to get a facial done. Okay. So dermatologists also have facials which we call medifacials. These are medicated facials.
Okay.
We also have it in our clinic. A lot of people are doing it, most of them. But it is not that we recommend to every patient who is coming to us. Okay. For example, if you are coming to me for a general skincare routine and you don't have any pimples, you just want a glow, you tell me that you have a shoot with a famous personality in 3-4 days, I can recommend you a facial. That will be medicated according to your skin. So what you are expecting, if you want a glow, you want a hydration, I will put those serums in the facial and I will deeply cleanse it. Okay. Facials are nothing but deep cleansing.
Deep cleansing.
But I would also tell you that Sneha ma'am, it is only going to last 1 week.
Okay, that's what I was about to ask.
So don't think that you'll get 10 facials or 1 facial and you are done for the life.
So for an event or something, it's okay. Otherwise,
it's okay.
If you maintain your face with a good morning routine, with a good night routine, you don't need to go कि अब मैंने 3 महीने अपना फेस खराब किया, now I'll go for a facial. एक सैलून में जाऊंगी, एक अपॉइंटमेंट लेके instantly overnight एक रिजल्ट मिल जाएगा. अगर मिल भी जाता है तो it won't last for more than a week. कितने भी promises कोई कर ले. I'm not accusing or blaming salons, but जब आपकी आंखें बंद होती हैं, फेशियल्स में आपको नहीं पता है उनके हाथ में कौन से प्रोडक्ट्स हैं, कौन कौन सा ट्यूब खोल के आपके ऊपर क्या लगा रहा है. सो ऑलवेज रिमेंबर वन थिंग, जितना एवरीडे का मेंटेनेंस फेस का होगा ना, वहां तक जाने की जरूरत ही नहीं पड़ेगी. इवन इफ यू वांट टू go to a trusted salon, see the work procedure. I'm not saying everyone does that, but ऐसा होता है, ये हम सबको पता है. So please wisely choose your salon wisely, choose your dermatologist of course wisely. So Dr. Suhani, now
I think one thing I'll add in this, कि a lot of famous salons have also bought very expensive facial machines, but still they might have the same machine which a dermatologist has, okay, which we commonly known as hydra facial.
yeah, people say that हम भी करते हैं, हाँ.
Yeah. So a lot of salons have come up with those machines, but it doesn't matter what machine you're using, it is the one who's doing behind it. If they don't know what type of skin or what type of product is going to suit you, even if you buy a 1 crore machine, it might not work for you, and you might have to land up in a dermatologist clinic.
Yeah.
So be wise. Nobody is against the salons, because they are also big chains, they know, but obviously be mindful whether you require a facial. For example, if a patient is coming to me and they want to get it done from a salon, if they can do it, I would recommend it's okay, go to a good salon and you can do it if you don't want a medifacial per se. But be very mindful who is doing it.
Pre-wedding, we are obsessed with pre-wedding procedures. कि अब शादी होने वाली है, now I'll start. Two things. Pre-wedding बहुत harshly करवाना जाके salons में, is it right for hours in a go? या फिर एक pre-wedding ritual क्या कर सकते हैं brides to be, जिनकी शादी होने वाली है, और कितने महीने पहले से स्टार्ट करना चाहिए? थोड़ा सा एक्स्ट्रा केयर, एक्स्ट्रा सप्लीमेंट, एक्स्ट्रा टॉपिकल एप्लीकेशन.
So the major problem with the ones who are looking at a pre-wedding regimen is that they come just 15 days before it. अब like we are not magicians, so a lot of patients also come to us कि मैम 15 दिन में शादी है, अब हमें तो आप नहीं करना जो करना है. We cannot do it, nobody can do it. The best of the salon in your city will not be able to do it. You have to maintain a proper skin regimen, you have to take proper diet, keep your wedding stress under control. Then you can go for the added procedures or whatever you want to do, but you have to give us minimum of 6 to 8 months. Anything less than this, we'll also not be able to help you fully. That is one thing you have to understand. Skincare is a consistent journey. If you have been having a consistent skincare, you might not need any facials, any advanced procedures, you might not need it. So if you are consistent since 6 to 8 months, then you can just, for an added glow, for that particular function, for that temporary period of maybe 7 to 15 days, you can go for the procedures. Going vigorously all in is rather damaging.
Okay.
And then you'll need some dermatologist will have to be in there to reduce it a bit.
Okay.
But again, that puts us in a spot.
Right. No, you're right. I think हम लोग ये सोच लेते हैं, you guys are magicians, कि हम कितना भी डैमेज करके चले जाएंगे, आप लोग तो ठीक कर ही दोगे. Also, massages. How good is a massage? Basic massage, जो home care routine में लोग बस massages करते हैं, कितना ठीक है वो?
Again, massages are temporary.
Oil massages basically.
Oil massages are temporary. If you have a dry skin, they're perfect. No problem. You can massage it n number of times. Obviously, if you have an oily skin, they might lead to breakouts or they might lead to small bumps on your skin. Then it is not recommended. But again, massages will always be temporary. It is not because recently there has been a lot of hype about face massages making it slim. That is not the case. So by massaging your face, you're not going to get slimmer. The oil massages for your body will help you give the hydration. Like I said, in babies, we have always I think all of us must have received oil massages. So that is okay for hydration.
And we have received uptons also. How good is an upton?
It depends. Some people with sensitive skin, they might react to it, so we don't recommend it.
Okay.
Anything which is a home remedy, I'm sure you'll have tons of ideas of home remedies which people are using.
मैंने नींबू भी डाल दिया, मैंने बेसन भी डाल दिया, I've used दही also, I've used शहद also, I've used oats भी लगा लिए. Somebody told me, अच्छा, actually this was being, somebody told this to me. आप क्या करना, bread लेना and soak it in milk for some time and then apply it on your face. So that was kind of lame, I didn't do it, but I want to ask you, क्या घर में पड़ी हुई, किचन में पड़ी हुई सारी चीजें safe होती हैं face के लिए?
It is a humble request of a dermatologist, please do not go crazy about home remedies. They do not work for everyone. That is for sure. If you have problematic skin, if you are not having a genetically blessed skin, anything on this earth can react to you. That you have to understand. Especially if you have very dry or sensitive skin, you should not go for these. A lot of patients come to us, they've applied potato juice for pigmentation. They've applied besan and dahi to get fairer. No. Cucumber.
Especially nimbu. Especially the lime juice is like, actually it's acidic, right?
Yes. So the thing is, there is, I'll tell you the science behind why it has worked for some people. Okay. So dahi has worked for some people. Like you said, nimbu has worked for some people. Why? Because nimbu has citric acid, dahi has lactic acid. That is a weak acid, and it does have a scientific relationship with reducing the pigmentation. So the medical peels that we do, they also contain these citric and lactic acids, but they are in that form that it is not going to harm you and it is going to give you results. But in the current situation, your skin may be in any situation, doesn't mean dahi and nimbu is going to help you.
Aloe vera?
Aloe vera is just a hydration component. It is a lot of aloe vera has been incorporated in our creams. But crude aloe vera, it is not recommended.
It is not
apply.
recommended.
No.
Okay. The processed one is better.
Yes, it might have worked for some people. It has drastically given damages to other people. So why to take a risk?
Right.
So I'll tell you a very funny incident. Even when I was small, I have used Multani Mitti and it has given me the worst reaction ever. While I don't have a problematic skin, but Multani Mitti has given me the worst reaction ever. Now we don't know how pure is what we are getting. We don't know. Home remedies are not recommended.
What about neem? People say pimples के लिए neem लगाना ठीक है. For those who say कि मैं तो products में नहीं जाती हूँ, I want to use what is available at home.
Again, the thing is, it is a contradiction. Some people who have applied neem, maybe it has worked for a few people, but mostly it is damaging. A lot of people, they come with pigmentation after applying the crude leaves of the plants, or they've applied, like you said, aloe vera.
So nothing crude should be there?
No, nothing crude should be there. First, you visit your dermatologist. If we have a safer method to give you improvement, why do you want to go for that neem patta thing?
Right.
So neem, tea tree oil, all these things are there in our products.
Right. मुझे हर बात पे आपकी वो बात याद आ रही है. हमने इसीलिए तो 10 साल पढ़ाई की कि हम आपको ये बात बता पाए.
Again, everything comes down to मैंने इसीलिए तो पढ़ाई करी है. Why would I give my most crucial years to a subject like this?
Right. And then every patient that comes to you is like a project to you. You want to make it better, right? Naturally it happens.
Yeah, so people should realize that as doctors, anybody who is coming to me, at least I can say this for all the dermatologists, we never want to harm anybody. Obviously, we'll treat them, the happiness that they'll give us. They are also obviously going to spread the word of mouth, and more of the people will come to us. We are never there to just sell the products. We are obviously there to give you the happiness that you have a healthier skin. Don't go for a fairer skin, I would say. Go for a healthier and happier skin.
That's good. Yeah. Obsession with the fairer skin. You must be seeing this a lot in your clinic, right? So in your clinic, how many patients out of 10 in a day come to you with the demand or a request for a fairer skin?
Yeah, so I think it's a very sad part, but I think 50% of the patients are obsessed with fair skin.
50% you would say?
Yes, it is a very complex problem, especially in India, because we are very influenced with the traditions and the old cultures. That is mostly, I think, influenced by the movies that we see or the advertisements that we see. Now you remember the Fair and Lovely advertisement or any fairness cream advertisement, I would say. So everything was reducing the tone. So that is the problem, especially in our population. One should realize we cannot make you fair. It is all the genetics behind it. If I have a certain tone, I have been genetically given it to me. I cannot change it. We can obviously lighten it to some extent. That is your own natural tone only.
Right.
But we cannot make you fair.
ये बात आपको उन लोगों को समझानी है जो लड़की देखने जा रहे हैं. उनको लड़की की हेल्थ से कोई मतलब नहीं है. लड़की के इंटेलिजेंस से भी बहुत जल्दी उनको कुछ लेना देना नहीं है. They want a fairer skin, fairer tone. उनको वो बहू चाहिए जो बहुत गोरी है. ऐसे लोगों को आप क्या बोलोगे being a dermatologist?
See, the thing is, a lot of times we have to counsel such people. सिर्फ उन लोगों को भी और उनके साथ जो उनके घर वाले हैं, sometimes they also have an issue with it. उनका stress भी उन्हीं को ही संभालना पड़ता है. Those young girls who come to me कि हमारी wedding है, they have been rejected by somebody. Recently I've seen a lot of patients. कोई rejection हुआ, मैम उन्होंने कहा मैं गोरी नहीं हूँ, मेरे pimples हैं, मेरे बाल हैं. It is okay. We have solution for everything. Don't worry, don't stress about it. It is their loss, first of all. if they have just seen the outer appearance. We say don't judge a book by the cover, it goes the same. So don't stress about it, there is a solution for it, we can manage it, give us some time. Obviously it is not going to be done overnight, but everything will change for good. But you need to have a support system. It is very important.
So even for families, this is very, very crucial. This is very important. Make your girls, your daughters believe in themselves. देखो जो उनका स्किन टोन है वो उससे फेयर कैसे हो जाएंगे और होना भी क्यों है, क्यों फेयर होना है किसी और के लिए. एंड दे वुड एक्सेप्ट सर्टन स्किन टोन. दैट मीन्स उनको आपकी नेचर से, आपके इंटेलिजेंस से, आपकी पर्सनैलिटी से कोई मतलब ही नहीं है. सो स्पेशली दोज पेरेंट्स हु आर वॉचिंग, वो इस टेंशन में रहते हैं कि मेरी बेटी का रिश्ता कैसे होगा, मेरी बेटी की शादी कैसे होगी. अभी कुछ लोगों को लग रहा होगा आज भी ये होता है. यस, बहुत ज़्यादा ये होता है आज भी, बहुत ज़्यादा. एक बहुत छोटा स्टार्ट है सोसाइटी का है जो अभी भी चेंज हुआ है. इफ़ डॉक्टर सुहानी एज अ डर्मेटोलॉजिस्ट इज सेइंग कि हम आपको फेयर नहीं बना सकते ओवरनाइट, सो प्लीज़ एक्सेप्ट द वे यू आर. देखो फर्स्ट एक हार्श वर्ड में बोलूँ तो कोई ऑप्शन तो है नहीं. यू हैव टू एक्सेप्ट योर सेल्फ. और अगर इसको पॉजिटिविटी में लिया जाए थोड़ा सा, सो लेट्स एम्ब्रेस इट. अभी हम थोड़ी देर पहले बात कर रहे थे डॉक्टर सुहानी के साथ, मेकअप का सबसे ज़्यादा मज़ा डस्की स्किन टोन और वीटर स्किन टोन पे आता है. तो इसका एक पॉजिटिव पॉइंट निकल आया, राइट? होता क्या है, द सोसाइटी, द पेरेंटल प्रेशर, उसकी भी शादी हो गई, इसकी भी शादी हो गई, मेरी बेटी की क्यों नहीं हो रही है. यू कीप हियरिंग सच थिंग्स एंड देन यू कम अंडर प्रेशर. और आपको शायद कोई फेस पे कुछ ना बोले, लेकिन आसपास की ये बातें आपको बहुत प्रेशर में डालती हैं. एक कोई आंटी आ जाएंगे एंड दे विल से कि अरे बेटा ऐसा ऐसा स्किन टोन क्यों है, अच्छा तुम्हारा रिजेक्शन भी हो गया, हाँ हाँ मैंने सुना था. हमारे लिए शायद बोलना बहुत ईजी है टेबल पे बैठ के कि नहीं नहीं प्रेशर मत लो, बट गर्ल्स पे ये प्रेशर इंडियन सोसाइटी में डेफिनेटली होता है. बट इसका कोई सोल्यूशन नहीं है. यू कांट ट्रीट पीपल. अगेन, अगर बाहर मस्कीटोज हैं तो आप बाहर जाके मस्कीटोज को नहीं मारोगे, आप अपना विंडो बंद करोगे. सो जस्ट क्लोज योर विंडो. फर्क ही नहीं पड़ना चाहिए, बोलने दो उनको. इसका कोई भी सोल्यूशन नहीं है. सोल्यूशन सिर्फ एक है, लुक एट योरसेल्फ इन द मिरर एंड से आई एम ब्यूटीफुल द वे आई एम, नो मैटर वॉट. आज हम लोगों ने थोड़ा बहुत मेकअप किया है बिकॉज हमें मजा आता है मेकअप करने में. हमें लगता है कि आई एम फीलिंग कॉन्फिडेंट. अगर आपको उससे कॉन्फिडेंस लग रहा है तो वो लगाइए, उससे भी नहीं लग रहा है तो देयर इज नो नीड टू डू एनीथिंग. बेसिक स्किन केयर करो, स्किन को हेल्दी रखना जरूरी है रादर देन फेयर रखना. नाउ
just to add to that, that you need a support system. You should surround yourself with good friends and family who's backing you up, ताकि आपका वो स्ट्रेस थोड़ा कम हो. Always look for an even toned skin. If you come to me as a dermatologist, I can give you an even tone. I can improve the texture of your skin. I can smoothen it, but I cannot make it fairer. That is not going to happen whatever you do. So just go for a healthier, happier skin rather than a fair skin. It is high time that we leave this obsession now.
It's high time. It's more than high time actually. Also when pigmentation happens, I see skin tone वाला जो बात होती है, एक एज के बाद आपकी मैं देखती हूँ लोगों को कि उनका ना बॉडी शेड कार्ड बन जाती है, यहाँ कुछ और यहाँ कुछ और. स्पेशली दिस पार्ट इज पिगमेंटेड. एट टाइम्स इवन यंग एज में भी ये पार्ट बहुत पिगमेंटेड होता है जेनेटिकली. इज दिस ट्रीटेबल?
Yes, so like you said it very correctly. A lot of people don't know कि genetically भी कई parts हैं हमारी body में जो pigmented रहेंगे, and it is normal to have it. क्योंकि ये genetics है, हम इसको change नहीं कर सकते. But sometimes like around the eyes, around the mouth, even underarms, even the intimate areas, they turn darker. That can be one thing because of dryness. Secondly, अगर हम बार बार friction दे रहे हैं उसको, especially underarms या intimate areas में, if we are wearing very tight clothes, or if we are waxing again and again, और trauma दे रहे हैं हम किसी तरह का, then if we are sweating a lot, that is also accumulation of dirt and everything if we are not cleaning them properly. Again, and if we are using deodorants and antiperspirants like directly on the skin, so that is also one thing.
It's not right.
It is not right.
What about those roll-ons that don't have fragrances?
They don't work. Should not be used.
Okay.
Nothing on the skin should be used unless and until it has been advised by a dermatologist.
Okay. We
only recommend products which are least harmful for your skin.
Okay.
Nothing deodorant or antiperspirant, anti-sweat has to be applied directly on the skin if we have not recommended it.
Okay. Many men face this. After shaving, they have little bumps at times. There are cuts. There's dryness. What are some more issues that you've seen in your clinic related to shaving?
Yes, shaving can be very tricky for everyone, even men and women both. So the major issues like you've touched, that whenever a person shaves, there are a lot of cuts, there are a lot of bumps which we call folliculitis. So why this happens is the cuts happen because the method of shaving can be wrong.
Okay.
Firstly, you have to hydrate it. You cannot dry shave ever.
Hydrate how?
You can either use a shaving cream, either you can use plain water or a moisturizer. Any moisturizer will do. You have to shave it in one direction, that is the direction of the hair. If you shave it in the opposite direction, you are bound to get those bumps, you're bound to get those cuts. If your skin is very dry, anyways, you're bound to get cuts.
Okay.
So you have to make sure that you're not doing it in that way.
Okay.
Whether it is the beard area because there is maximum hair growth, or it is the women who are shaving on the body, shave in just one direction, in the direction of the hair growth.
That means if the hair is like this, you can't do shaving like this. You have to go in the same direction.
Yes, because when you shave oppositely, the hair might roll on inside and deposit inside and make a bump. So that will be more problematic.
So people scrub these days a lot. Before shaving, they'll scrub it, and then they'll shave, and then they'll apply especially those full of fragrances post shaving balms or post shaving creams.
Yeah, so scrubbing before shaving is not recommended because you are just preparing for micro traumas more.
Okay.
So scrubbing is anyways giving you a trauma. Then your shave will give a trauma. So it is going to turn into very traumatic process.
Right.
No need to scrub it. Just use any moisturizer. Even shaving creams act as a moisturizer only. You can use any moisturizer. Just apply over it, and then you shave it in the direction that I've told you. That's it. After shaving, why people use after shaves or balms? Because they are antiseptics. So that if they have a cut, that will manage.
Okay.
So if you're not getting a cut, if you're using a moisturizer properly, you might not need an aftershave balm or any fragrant thing.
तो जैसे वो करने की जरूरत नहीं, जैसे बहुत सारे एड्स में दिखाते हैं गर्ल्स आ गई बहुत अच्छा एक पोस्ट शेव लगा के.
So the thing is मैम कि अगर परफ्यूम और शेविंग क्रीम से गर्ल्स आती तो world would have been very different. It is not like that.
Okay. So these days men with beard, क्योंकि बहुत ट्रेंड है beard का, any special recommendation for them?
So yes, since beard is a lot of in trend, so what you should do is always clean the beard properly. There are a lot of infections which come with the hair. You might not be cleaning that area properly. Face washing only the skin will not help. You have to clean the beard area also. That is one thing. Shaving, again, the tips that I've given for shaving, you should follow that. And again, the growth of the beard, some people are very emotional about it. It is also genetically determined. And there are certain solutions if you want little heavier beard. So you should always, you can ask a hair expert like us. Dermatologists handle all the concerns related to skin, hair and nails. A lot of people don't know this. So they can come to us and we can see what their expectations are. Some people are also these days obsessed with laser hair reduction for beard. So that is also one thing, one service which dermatologists provide. Okay. So if you want a chiseled beard, we do laser hair reduction on the other part. Okay. So that gives a shape to the hair. It is called beard shaping.
Wow. I thought only barbers would do it, but you are do it technically right.
Yes.
Right.
But for men per se, an advice is that skincare is for everyone. Please just don't put everything together.
Yeah.
Follow a routine. A lot of things are changing. We have a lot of male patients and they are very good patients. They are very excited to see to use the products, but obviously it is a very small strata. And some people tell us, ma'am, ye bhi de rahe ho, how will we apply it? It's okay. Go with the flow. Just start it. You are going to feel wonderful once you're consistent with it.
So 2 categories.
Yeah.
Men would either say, what else do we need? Just water and towel. I'm ready to go to a wedding. है ना? और एक होता है कि मैम apply क्या करूँ? So particularly for men, I'd like to say one thing. Skin care is not makeup. Skin care हमने क्योंकि society में सुना हुआ है men को क्या ज़रूरत है? अगर men को brushing the teeth की ज़रूरत है तो skin care की भी ज़रूरत है. We are not saying कि दिन भर आप वैक्सिंग करवाने बैठ जाओ कहीं पे, दिन भर आप पेडिक्योर मैनिक्योर्स करवाओ, बट अगर आप करवाते हैं तो दिस मेंटेन्स योर हाइजीन ऑफ योर स्किन एंड योर बॉडी, सो दैट इज नेसेसरी, इट्स नॉट अ लग्जरी. सेंसिटिव स्किन, डॉक्टर सुहानी, सेंसिटिव स्किन वाले लोग बहुत प्रॉब्लम में होते हैं, ना वो सनस्क्रीन्स लगा पाते हैं, उनको उससे भी प्रॉब्लम होता है, ना वो मॉइस्चराइजर्स लगा पाते हैं. एक्सट्रीमली सेंसिटिव स्किन वाली गर्ल्स क्या कर सकती हैं?
So, जिनका sensitive skin होता है, they have to understand that they cannot use any harsh products on their face. They might have understood by now. They have to go for a very gentle cleansers. So there are cleansers in the market which are available, which are soap free. So if we realize that you have a sensitive skin, obviously we'll give you the mildest of the products and we'll not give you too many products.
Okay.
We'll mostly basically keep on a very mild cleanser, which is not even a face wash. It is not even having soap.
Okay.
And a good moisturizer, because we need to create a barrier. Otherwise, anything or everything under the sun can be allergic to you, can make you sensitive, can make you red. So we have to keep that in mind. We'll give you a barrier in the form of a moisturizer, and sunscreen is for everyone. Obviously, the contents of the sunscreen will be chosen in a way that they are not irritating you.
Right. Okay.
Yeah.
Okay, thank you so much, Dr. Suhani. This was relevant, useful, crucial, important. मैं कितने synonyms लूँ? I would, I should rather carry a thesaurus. So skincare it's not deep. It has to be sensible, first of all. Thank you so much for throwing
No
light on
problem.
so many things.
The pleasure is mine, ma'am. I think there's a lot to know about skincare, but you should obviously talk to an expert.
Yeah.
Yeah.
That's why I'm talking to an expert. Thank you so much for being
Thank
here.
you.
Viewers who are watching us, जिनको कोई पर्सपेक्टिव शेयर करना हो, कोई ऐसी प्रॉब्लम हो जो हमने यहाँ कवर नहीं की है, प्लीज कमेंट्स में, ईमेल में, डीएम्स में, प्लीज राइट इट टू अस. We'll try to address it in the next episode whenever we are shooting it. I hope मेरे क्वेश्चंस और डॉक्टर सुहानी के आंसर्स ने आपको थोड़ा सा सेटिस्फाई किया है और थोड़े से आपके जो मिथ्स हैं उसको बस्ट किया है और बहुत सारी प्रॉब्लम सॉल्व की हैं. You were at LIPS Lifestyle Image Personality Skill with me, Sneha Singh. Thank you so much for watching us.